Mel, can we have a roll call, please? Am I on?
Here. Here.
Here. Here. Here.
Here.
Here.
Present.
Review and approval of the meeting minutes from March 7th, 2023. Anyone like to make a motion to approve?
Mr.
those?
Chairman,
Mr. Rubin.
on the last page, under Finance Committee, we have an error. It says that we paid $6,682,000, 30.58. I believe that should be $682,030.58.
So there's an extra 6 on there?
Yes.
Okay. Making that correction.
I will make a motion to approve the minutes as amended.
Second. All right, we have a motion and a second. Any further discussion? Any other changes to the minutes? Hearing none, can we have a roll call, please, Mel?
Yes. Yes. Yes.
Yes. Yes.
Yes.
Yeah.
Yes.
All right, thank you. Review and approval of today's agenda. There a motion to approve the agenda for today's meeting.
I will make a motion.
Thank you, Don.
Support.
Supported by Mr. Rubin. Any discussion? I think we can just do a roll or a voice vote on that. All in favor, say aye.
Aye.
Any opposed? All right, public comment. I'm guessing that a few folks want to address us. So our public comment rules are attached to the agenda. You'll have 3 minutes to address the board. Mr. Chamberlain is going to be our timer today. He will advise you at 30, when you have 30 seconds left, you have 3 minutes to address the board. He'll advise you when you have 30 seconds left, and then he'll advise you when 3 minutes are up. We're going to ask that everybody abide by the rules, and we are interested in your comments. You have a list for me, Chris? Thank you. So I have a list for people that want to address the board. If your name is not on the list, you can still address the board. We'll just take you after this list is complete. Having said all that, I'm going to ask that you state your name and your county of residence, and then the timer will start. First up, I have Herb Frisky.
My name is Herb Frisky from Petoskey. I believe it is the utmost importance that the proposal put forth by Commissioner Ginup be adopted. The insanity of forcing people. The insanity of enforcing people to wear useless face masks and be injected with dangerous experimental vaccines must never be allowed to happen again. We were told that these draconian edicts were needed to save the lives of millions of people. The results, however, demonstrate the exact opposite. Dr. Robert Malone, one of the scientists that actually developed the mRNA vaccine, is a spokesman for a worldwide network of 17,000 doctors and scientists who are very alarmed at the adverse effects of the COVID experimental drugs. He recently presented the following declaration on behalf of all these doctors and scientists, quote, "We declare, and the data confirms that the COVID-19 experimental genetic therapy injections must end. We must acknowledge that these genetic injections cause far more harm than good and provide zero benefits relative to the risk for the young and the healthy. They do not reduce COVID infection. Furthermore, the most recent data demonstrates that you are more likely to become infected or have a disease or even death if you have been vaccinated compared to those who have unvaccinated. They can damage your heart, your brain, reproductive tissues, your lungs, and they can cause permanent and disablement of your immune system, end quote. It is absolutely clear that some very evil individuals concocted a virus in a laboratory, released it into the human population, and then fanned the flames of mass hysteria in order to get the people of the world to accept tyrannical and illegal edicts. Never in the history of the world have we seen such a concerted effort to treat people like mindless sheep. The political, economic, and intellectual elite believe that they have a God-ordained mandate to manage the affairs of the world. For example, Klaus Schwab, the founder and the head of the World Economic Forum, arrogantly boasted of this fact when he stated, quote, "You will own nothing and you will be happy," in his heavy German accent. Once they managed to confiscate our guns, those of us who refuse to be
30
happy about
seconds.
owning nothing and refuse to be injected with their toxic chemicals, we will be slated for elimination. Although Commissioner Ginnup's proposal will not protect people outside of our area, it will go a long way to protect those of us who live in Charlevoix, Antrim, Emmett, and Otsego counties. Thank you for your consideration.
Thank you, sir. I'm looking over the list here and I want to apologize up front to everyone if I get your name wrong. Next I have Vicky, I think Blau. I apologize for,
Yeah, I'm Vicky Blau from Vanderbilt, and I want to voice my support for the continued autonomy of the health department. I don't know where we're headed when we try to obstruct and override the trained professionals when it comes to community health. I think this medical freedom resolution is deeply disturbing, and the folks who drafted it and are pushing it need to reflect on their intentions. Thank you to all of our dedicated health department staff. We truly appreciate your expertise and devotion to community health. Thank you.
thank you. Bob Kingham, thank you, sir.
Yes, I'm a resident of Milton Township, Antrim County. Was a public health worker for 55 years, 30 years with the Centers for Disease Control and Prevention, and 25 years as a consultant to agencies and nonprofits and universities. In March of 2020, retired colleagues of mine, about 20 or 30 of us, started having Zoom calls every Thursday afternoon, talking about the travails of dealing with this pandemic of COVID. Some of those guys and gals were on boards of health like you are, and thank you for your service, by the way. And so I moved forward to early 2021. And a lot of the discussions we had at that point were the difficulties that communities were having rolling out the vaccines, making them available to senior citizens. And contrast to all the difficulties I heard from my colleagues around the country were the success of our Northwest Health Department in making them available, making them efficiently available. And I recall going to Mansalona in a snowstorm and getting in and out very efficiently and very carefully. The work, the programming, the efficiency that the health department did clearly prevented some deaths in our area. I also just want to make the point that in terms of my wife and I, the people that we know who since June of 2021, who have died from COVID, who are now suffering from long COVID, are those who made the choice not to be vaccinated. Now, we can respect their freedom to make that choice. It's just very, very sad to us that they made the wrong choice. Thank you.
Lou Ann McKimmy,
My name is Luann McKimmy and I'm from Antrim County. I would like to address the resolution to be considered today. County commissioners have many important jobs and serve in a necessary capacity. However, if I have cancer, I do not go to a car mechanic for advice. If I have a car problem, I don't consult a plumber. When another pandemic or epidemic arrives, I do not plan to seek information from my county commissioners on how to protect myself and my family. We've hired people, educated and trained at taxpayer expense in healthcare. We appreciate their commitment. Let them do their job.
Sue Vandeventer. I hope I got that right. Okay.
I'm from Sue Vandeventer from Emmett County, and I have two issues I want to comment on. First of all, I attended the Program Evaluation Committee meeting on February 23rd via Zoom and was so impressed with what I learned about the work of the Health Department. Each staff member that reported on their respective programs did so not only with factual knowledge based on studies and assessments, but also spoke with great enthusiasm for the programs they administer. It was inspiring to see these career professionals show such passion for the work that they do, even for their most obscure programs that may not serve many people, but certainly make a real difference for those involved. I hope you see that these grant-funded programs, not just as money spent, but as investments in people's lives. Investments that are very often life-changing and at the least improve the quality of life for residents in our health department service area. We are fortunate to have such dedicated professionals working for our health department. I also have a few comments on the proposed medical freedom resolution. First of all, direct state involvement in local policy is a rarity, and this proposed action is an overreaction. All of the adverse COVID countermeasures in this resolution were the result of a once-in-a-century pandemic, not the actions of our governor or the health department. Secondly, the health department is required to act in compliance with state law, and yet this resolution attempts to bar them from implementing future COVID or masking mandates. Mandates are tantamount to law. Does this board have the legal or medical authority to disregard state law simply because it dislikes or disagrees with them? And thirdly, are you confident that if you pursue this resolution, you won't be exposing the counties involved to costly litigation, which would be a needless waste of taxpayer dollars? Finally, I'm not familiar with the professional backgrounds of everyone on this board, but I truly have respect for whatever it is you do and great appreciation for your willingness to serve the public. However, when it comes to health information or recommendations, I want medical policy to come from medical professionals in the field. This resolution feels more like a direct political statement aimed at our governor and the health department, rather than a policy that would truly benefit our communities. Thank you.
Mary Lieberman.
Hi, I'm Mary Lieberman, and before I start, I'd like to ask, is there any way you could turn your microphones up? It's really hard for some of us to hear you. But anyway, I'm from Emmett County, and it's my understanding that this is National Public Health Week. And I'd like to take this opportunity to express my appreciation and gratitude to the staff and the leadership of the Northwest Department of Health. They've been outstanding. You've heard the saying, when the tough get going, the tough, or when the going gets tough, the tough get going. These people have been relentless. Not a one of us sitting in this room knew what to do when this pandemic hit. But they didn't have the option to just go home and buckle down like the rest of us did to take care of our families. They had to go to work and try to figure out what can we do to protect these constituents. And they did it. They did it with dignity and grace and based on their professionalism and their science-based research. These people deserve to be applauded today, not to be threatened with a resolution that takes away their dignity and respect and deprives them from exercising the leadership that they've been hired to do. These people are professionals. I can't say that the vast majority of us in this room right now could possibly even randomly do their jobs. They deserve your support, not threats of being micromanaged and taking that leadership away that they provide to our communities. There's thousands of constituents that are being impacted by the decisions that are made by this board. While I recognize that there are some people, some constituents who feel differently about mask and vaccinations, that's their prerogative. They have a right to feel that way, but this isn't the avenue to address that. Let these people do their jobs. You've hired them, let them lead. They are the professionals. Thank you.
Chuck Loftbaum.
Hello, I'm from Center Township in Emmett County, and my name is Chuck Loftbaum. Dr. Fauci was by far the highest paid employee of our government and NIAID director. His main job was to keep infectious diseases out of the United States. Not only did he fail, but it is now coming out, excuse me, that he actually caused the United States to become infected with the coronavirus with his crazy gain of function experiments. Gain of function is a term used to describe taking a very bad disease and making it even more deadly. Dr. Fauci has long advocated for this in the United States. He has gone on the record as saying the benefits are worth the risk. He was wrong about many things. When I asked a retired Florida state policewoman why the government would play around with gain of function, she thought it was probably intended for military use. When Congress learned about this, they ruled it that it was much too dangerous and banned it from the United States. Dr. Fauci did not take no for an answer. He moved it to China and funneled millions of US taxpayers' dollars to the Wuhan lab through a third party named EcoHealth. It is my opinion that Dr. Fauci will be found guilty of lying to Congress under oath to cover up his mistakes. He approved thousands of dollars in grants to doctors who pushed his idea that COVID-19 came from an animal. Doctors who thought it came out of the Wuhan lab were blacklisted and received no grants. They were also censored. Dr. Fauci declared, "I am science." I see him as a very arrogant elitist. President Trump made a big mistake in listening to him and shutting down the United States. Vaccine injuries and deaths have largely been hidden from the public. Our government has classified the origins of COVID-19. Why? Was the CIA involved? They have much to hide. This was an opinion letter I wrote to the editor of the Harbor Light newspaper. It was submitted last Monday, March 23rd. He does not want readers to read it. He says our newspaper accepts letters of local focus only. To me, this is the local focus because it affected our constitutional rights, which are much more important than any disease. We were locked
30
down.
seconds.
We were told to stay home, don't go to work, don't go to school, don't go to churches, don't go for cancer screens, don't go to dental care. About a year and a half ago, a Michigan court said that Gretchen Whitmer, the governor of Michigan, violated our constitutional rights. And I agree with that court. Thank you very much.
Martha Lancaster. Okay. Bob Wiley.
I'm Bob Wiley, and I'm from Emmett County. I'm a retired physician and have done over the last 2 years, probably over 2,000 hours of research concerning COVID, its origin, and the vaccines. In regard to the U.S. government's position and edicts. I can personally attest that there have been many financially motivated, unethical positions that are often driven by an unholy alliance between the US government, pharmaceutical industry, and the media. The evidence is damning in how they have co-opted public institutions. And my heart goes out to boards such as this, because it's almost impossible for you to know what is right and what is wrong. I thought it was amazing that there were quite a few people that laughed at Chuck Lofbaum's presentation, and I fully support what Chuck said. And a lot of what Herb Frisky said, most of what he said, I fully agree. And I know there are many in the audience that have other opinions. And what you need to do on a local basis is going to be hard to determine. But I'd a lot rather have the local opinion than somebody in Washington or somebody in the CDC who has been motivated by $400 million that circulates round and round the merry-go-round of the people that are collecting money off of a lot of these transactions. Thank you very much.
Mark, I think it's Grabilski. Okay. John Swartout.
My name is John Swartout. I'm from Emmett County. Continuing from my comments last month, I was about to expound on the similarities between the practice of seamanship and the practice of medicine and how train wrecks, both nautical and medical, may occur. I said that maritime accidents are usually the result of not one, but a series of errors, usually by more than one person. So there are often multiple opportunities to interrupt the chain of errors leading to disaster. You remember the container ship Ever Given running aground 2 years ago in the Suez Canal. It blocked the canal for 6 days. 369 other ships were delayed. There were supply chain interruptions, held up 12% of global trade, cost billions of dollars. How about the container ship Ever Forward that ran aground in the Craig Hill Channel in Chesapeake Bay 13 months ago? Bigger ship than the Ever Given. Distracted pilot on his cell phone. The ship was stuck there for more than a month. Anybody hear about that one? Turns out maritime casualties are pretty common. There's even a form for it. Coast Guard Form 2692, Report of Marine Casualty. I used to carry a few of those with me all the time, just in case. And I had to fill out a couple of them, sad to say. But the Coast Guard investigates about 5,400 of these a year, hundreds of them on the Great Lakes, but no blood, no pollution, no headlines. By the way, do doctors have to fill out a form when they make a mistake that results in injury or death? Medical 2692 to be investigated by their regulators? I don't think so. They must have better lobbyists than ship captains do. Well, it's probably not that common anyway, right? Au contraire. In an August 4th, 2021 stat article, law professors Michael J. Sachs and Stephen Landsman wrote, this summer, surgeons at university hospitals in Cleveland transplanted a donor kidney into the wrong patient. Well, the patient the kidney had been destined for had to go back on the waiting list for another one to become available. By the way, do you suppose more than one person had a role in that? The most surprising thing about the story is not that
30 seconds.
I have 6 minutes, right?
No. You cannot donate time.
That's what your rules say. The most surprising thing about the story is not that a serious medical error occurred, but that it found its way into the news. Injury or illness caused by the healer is called iatrogenic harm. It's so widespread, so frequent, so massive, and so continuous that it rarely makes headlines. And unlike a plane crash or a building collapse, the vast majority of iatrogenic
3
deaths
minutes.
can be kept under wraps, and they are.
I do stand corrected, sir, under our rules, number 4. Or no, correction, number 5. Says that with the permission of the chairperson, the speaker may comment for up to 6 minutes, equivalent to 2 public speaking slots. You have 3 more minutes, sir.
Thank you. In fact, death by medical error or accident is the nation's leading cause of accidental death, exceeding all other causes of accidental death combined. Unquote. My point here is that to err is human. And my bigger point is that the erring does not stop when you get a title in front of your name. As humans, we are prone to make mistakes, and professionals, much as they may camouflage it behind the uniform and the lab coat and the robe, are human. And to be fair, they do devise strategies to minimize their errors, and specialization helps. Yet ships continue to run aground, forceps get sewn into bodies, innocent men get arrested, convicted, and sent to prison, and catastrophic prescription drug interactions occur, all without the intention to do harm. Captain, professor, reverend, judge, doctor, we all make mistakes. And about the only thing that changes as the responsibility that comes with the title increases is the scale of the damage you can do when you fail. And I'm not talking about negligence. I'm not talking about moral failure. I'm going to get to that eventually. I'm talking about errors in judgment. I'm talking about trying to do the right thing and coming up short. The best laid plans of mice and men. But then we compound fallibility with pride. What C.S. Lewis called the greatest sin, the essential sin, the utmost evil. It was through pride that the devil became the devil. Oh, and as if that's not enough, we complicate error with legal liability. In our litigious culture, maybe in all cultures, there's a powerful bias against owning up to our mistakes. Both my parents suffered terribly and died prematurely because of medical errors. Did their doctors apologize? No, they didn't. We practice medicine.
30 seconds.
We practice law. We practice seamanship. Maybe being a professional means never having to say you're sorry, or never daring to say you're sorry. I'm sure my parents' doctors thought they were doing their best. To be continued.
Larry Corrick. Oh, I'm sorry, sir. That's okay.
We don't pronounce it as it is written. Larry Correll from Otsego County. I'm here. I encourage the commission or the board in their pursuit of protecting the citizens' rights to make their own decisions. However, I am here to urge caution as to how you proceed. It so happened I was on vacation. I received notice that you are making this motion that is coming up. I had lunch with a man by the name of J.B. Williams of the North American Law Center. To remind you, the North American Law Center and Catherine Henry is the one who took the governor to court over this issue. He sent me an email, which I received late last night. Some of you have seen it. The rest of you, wasn't able to. I want to share part of it with you. Per our conversation during your visit, it is a huge mistake to pursue any legislative effort to allegedly limit the authority of your county health department concerning orders to the community, be it COVID related or any other medical emergency. This is because the health department currently holds no such legal authority at all. In order for any executive branch agency to hold such power, if assigned that power by the chief executive, in this case, Governor Whitmer, the chief executive must possess that power legally in order to transfer that authority to any executive branch agency. The governor cannot pass to an agency any authority which it does not itself possess. As declared by your state Supreme Court in October 2020, Whitmer had no such authority and therefore could pass no such authority, despite the fact that most Michiganders thought otherwise and allowed her to continue ordering her tyrannical orders unchecked. Below the reports are of the events at hand. It reminds me of what happened in October 2020, and then what happened later when they addressed the earlier Emergency Orders Act. She is stripped of her power to go beyond 28 days, I believe it is. His comment is, make sure you do not reopen the issue by a poorly worded motion. I would urge caution as to how fast you move and make sure that you do not open a door that you might not be able to close in the future. Thank you for your time.
John Tillotson.
I'm John Tillotson. I'm from Emmett County. And I am in favor of the resolution that's being talked about. So 3 years ago, I was teaching physics at a private school. The school was shut down, and I tried to teach physics over Zoom. And so much of the whole country, education suffered, and I know firsthand what that's like. But we were told that there would be 2 weeks to flatten the curve. And the 2 weeks turned into about 2 years. And we were told that it was came from bats in the wet market. And later we're learning that it was a bioweapon that somehow got loose. We were initially told masks don't do any good. Don't bother with them. Then we were told wear a mask. And then we're told to wear 2 masks. And today, if I want to go get a blood test at the hospital, I still have to wear a mask, even though they don't do any good. Then the so-called safe and effective vaccine came out. And there was information that was contrary to that was heavily censored. And when the truth finally comes out, we'll probably learn that the vaccine has killed more people than COVID did. Keeping this somewhat personal, an industry in Petoskey, Michigan Maple Block, survived the Great Depression, survived 1 or 2 world wars. I don't know how long they've been in existence, but COVID killed Michigan Maple Block. So there's been economic consequences too. The governor was going beyond what was legislated for her to do. The Supreme Court said she couldn't do that. And so she put the health boards up to doing her bidding. And so to make a long story short, that's why we got a lot of new faces here. So I'm kind of
30
preaching to the
seconds.
choir and for some of you. But we are trying to resist tyranny. And I'm in favor of that because we've been subjected to a lot of tyranny. But I'd like to shift this conversation over to credibility. And I don't really know how you're going to address this.
3 minutes.
We've got
That's your
3
time limit,
minutes.
Mr. I'm sorry.
It is?
That
Okay.
is your 3 minutes.
Okay. Well, if we do have another bioweapon released, who's going to listen to the health department? That's a problem for you guys.
Thank you, sir. Craig Bell.
Good morning. My name is Craig Bell. I'm from Harbor Springs. I live there and I have a business in downtown Petoskey. This is my first health department meeting. I'm here because of the article that appeared in the news review on Friday. I believe that I'm also here today, having been a two-time COVID sufferer as a result of good science, good practices by this health department, good practices by the health professionals in this country. And only have one comment. It seems to me that the proposed action today is a result of politicians thinking that they know more than the scientists. I strongly oppose this resolution. Thank you.
Brenda Colbita.
Hi, I'm Brenda Colbita. I live in Emmett County. I speak in support of the proposed resolution today because it will uphold medical freedom by limiting orders issued by this health department. After COVID-19 began, we endured unconstitutional orders, lockdowns, forced masking, school closings, churches, restaurants, canceled weddings, sporting events closed, celebrations denied. We were forbidden to see loved ones, even if they were dying. If the masks ordered handed down by this health department proved how important local control and limited government are to maintaining health autonomy at the county level. The proposed resolution states that the health department shall not permit or enforce COVID vaccine mandates, mandated masking, or testing of asymptomatic persons. That last sentence about testing is especially important for me. During my son's senior year of high school hockey, he was required to wear a mask playing hockey because he would not submit to weekly COVID testing. It wasn't an easy choice. He took a stand anyway. It was obvious to everyone he would not comply. He stood up for what he believed in and refused to follow what was clearly a punitive act on the part of the state governing body who oversees high school sports. They were sending a very clear message: either submit to our mandates or you don't get to play. I'm so proud of my son. He is 17 years old and he got it right. We adults need to do the same. If we are to remain a free people, we must have a say in decisions pertaining to our own health. The arbitrary abuse of power we experienced under former health officer Lisa Peacock should never be permitted to occur in the future. Please vote yes on the medical freedom resolution. Thank you.
I apologize in advance. Legita Lapham? Did I get it right?
I'm a little nervous, so put up with me. Okay. My name is Legita Lappins and I reside in Emmett County. I am a retired medical technologist with 50 years of experience. I am here because of this resolution, which I believe is an overreach. It has been a chaotic time dealing with COVID and how to get it under control since it was a new virus and no one had a clue on what the virus was capable of doing. And it keeps on mutating. The health department has done its best to protect and keep citizens safe and be as truthful as they can when dealing with an unknown virus. The pandemic was global, affected everyone, and caused economic disaster. Precautions were put in place, just like in the 1918 Spanish flu: isolation, quarantine, good hygiene, disinfectants, masks, even the library halted lending books. But one thing that the 1918 did not have was the technology to develop a vaccine. I have to commend the pharmaceutical companies in developing a vaccine quickly. It took many volunteers to be guinea pigs to find a solution to the problem. Granted, it was not totally perfect, but it worked. Data shows that unvaccinated persons were the most hospitalized. Yes, there are side effects, but that happens with every vaccine. Some people are immunosuppressed and have to be very careful. Each person reacts differently to vaccines. I have had all the COVID vaccines and I have never had any side effects. If this resolution is accepted, what will happen in the future when we have another pandemic or epidemic, which will happen? We don't have time to have monthly meetings, letting emergency measures expire in 28 days, or time to vote on how to deal with this while people may be dying, being hospitalized, and having another chaotic situation. I put my trust in the health department personnel who are more qualified to deal with health situations than the layman who just objects to being told what to do. I would like to see where all this evidence comes from, because if it comes from social media, which mostly deals with disinformation, then that is not true evidence. Go to the CDC website and you will get all the data that you need. Unfortunately, freedom of choice has become political, and this action does affect the rest of society. Thank you.
Larry Dyer.
Good morning. I'm Larry Dyer. I'm a resident of Petoskey in Emmett County. And I'd like to express some concern about the resolutions that are being proposed today that purports to protect our medical freedom. I think it's an ill-conceived attempt to micromanage the actions of the health department and our paid professionals. It strikes me, in fact, as government overreach. Some future board of elected officials meddling in the actions of a public institution in ways that they can't understand, ways that are far beyond the training and understanding of those elected officials. You have a health department with trained professionals who are serving the community well. They have the knowledge and expertise to care for the health and well-being of the communities that they represent. And I think you would do well to let them do their jobs. My understanding of your responsibility is to provide oversight and some policy guidance to the health department to enable, not hinder, the health department in serving the health and well-being of their communities. I hope you take that responsibility seriously. If there's an underlying political agenda, this is not the place for it. I understand some commissioners have concerns about the conduct of the health department. I would like to suggest that you begin a practice of holding special meetings where no decisions need to be taken, solely for the purpose of sharing information, discussing, and clarifying understanding before any policy decisions are made. This resolution is a case in point. As motivation for this resolution, Commissioner Ginup is quoted in the Petoskey News Review as saying, and I quote, "I am sick and tired of the so-called authorities lying to us and not revealing the truth about vaccine damages, death, and injuries that are happening." Again, I think this is a case of misunderstanding and possibly misinformation. I am doubtful that this health department or anyone else in the medical authorities are deliberately lying or deliberately concealing information. There may be some differences of understanding, but if Commissioner Ginnip or anyone else has other information that they would like to share, a special meeting where they could bring those sources, so they could be discussed, analyzed, and arrive at a clear understanding with clear analysis before any policy decisions are made, I think would be an appropriate place to do that. There appears to be
30
a lack of
seconds.
trust among some of the commissioners for the health department. I think special meetings designed solely as learning sessions would be a good way to resolve some of that mistrust and encourage a more health working relationship. So I strongly suggest that you reject this resolution and consider a practice of special meetings where you can bring sources to the table, where you can learn from each other, you can learn from the health department, and you can arrive at a better understanding of
3 minutes.
the situation before taking specific action. Thank you for hearing my consideration.
Maureen Nicholson. Okay. Bill, I'm not sure about the pronunciation. Bill KLCO. You're gonna have to correct me there, Bill.
Good morning. My name is Bill Kelso. I'm from Emmett County.
Kels.
I oppose the proposed medical freedom resolution. I believe public health guidance should be based on medical science and not limited by the Board of Commissioners. I appreciate the guidance that has been provided by the public health during the recent pandemic, which helped keep my family safe. And I expect that to continue unencumbered by resolutions such as this into the future. Thank you.
Richard Spring.
My name's Richard Spring. I'm a resident of Charlevoix. I'm here and I could talk to you about all the reasons why I'm opposed to this resolution. But I think in terms more of what your obligation is in regard to this, your obligation as a board is to look at what's in the best interests of all the citizens of our area, not just the people who are here. And I was at a previous meeting of the health department that happened in the library in Charlevoix. It was pretty ugly. There were a lot of people who were just nasty. I'm glad to see that hasn't been the case today. But I also am troubled by when I see members of this board clapping for certain individuals and not clapping for other individuals who are speaking. I think we all come from a similar place of concern, some of us more a personal concern about personal freedoms. Those folks have a right to do as they please, but the health department really needs to look at the actual, what's in the actual best interests of all the citizens. That is represented by far more people than the people who are here today. And I'd like you to consider what their needs are in regard to this and put the health of our area first and foremost. Thank you.
Robert Fawcett.
Hello, my name is Dr. Robert Fawcett. I'm a semi-retired physician from Emmett County and previously an assistant clinical professor at MSU College of Medicine, Go Green. The board has a big responsibility for the health and even the lives of thousands of people in Northwest Michigan. And it's very important when you pass policies that they be based on solid facts and not on misinformation. We're all awash in misinformation these days, not only from the internet, but other electronic sources as well. But you have access to some very good authoritative information from your own health department professionals. And there's also good reliable sources you can find on the internet from university sources, medical websites, and so forth. There've been scores and scores of studies of the effects of vaccines for COVID. And the conclusions, without a doubt, is that vaccines save lives and reduce hospitalizations. This is not only in our own country, not only sponsored by the pharmaceutical firms that make it, but all across the world, these kinds of studies. And even if you look at our own country, if you look at the states that have the lowest vaccination rates, they have the highest mortality rates from COVID. That was in an article in Journal of American Medical Association this past January or February. And there are side effects from vaccinations. These are relatively rare. Occasionally there's serious ones like pericarditis or something of that nature. But if you compare the unvaccinated people to the vaccinated people, the hospitalizations, the death, the long-term disability is there in the unvaccinated group to an extent way above the vaccinated group. In the last century, I was on the board of directors of the Burns Clinic, and you suppose we did things like tell the OBGYN doctors what age they should start doing mammograms or how often? No, we didn't micromanage. They had the expertise to know those kinds of things, and your health department professionals have the expertise to know when to use tools like masking or vaccination or testing, because certainly a lot of COVID was spread by people who are asymptomatic. Either they didn't get symptoms or they were in a pre-symptomatic stage.
3 minutes. Sorry, sir, that's your time.
All righty.
Thank you. Hal Lawrence. I believe it's Dr. Hal Lawrence.
Well, good morning. I appreciate this opportunity. I am Dr. Hal Lawrence. I am a retired obstetrician gynecologist. I retired 2018 as the Executive Vice President and CEO of the American College of Obstetricians and Gynecologists. I've spent the last almost 50 years doing my best to improve the healthcare of women and families, not only in North Carolina and Michigan, but throughout this country. I come to you today to speak regarding the proposed medical freedom resolution and how it will negatively impact public health. The previous speaker very clearly delineated much of the science behind the benefits of vaccination. But guess what? In 1777, George Washington mandated the inoculation of the Continental Army of the soon-to-be United States for smallpox. Otherwise, we might not be standing here today and talking. So vaccinations or inoculations work. They save lives. They are core of public health. In fact, if you look at the data from the 20th century of all the medical technologies, everything that happened throughout that entire 100 years, guess which had the greatest impact in saving lives in the United States and around the world? Immunization. You have a great public health system here. I helped deliver 1,500 COVID vaccines. This resolution can potentially negatively impact that. Public health is societal health. I urge you to do what's best for not only everybody in this room, but everybody in Northern Michigan. Protect societal health. Thank you very much.
Harry Hodgson.
Hi, thank you for having me. I'm Perry Irish Hodgson and I live in Charlevoix County. I'm concerned about the board's current trend toward micromanaging the health department. This applies to both the actions to obstruct grant-seeking activities and to the resolution proposed by Commissioner Ginup. I'd like to share with you, with his permission, this letter from Rick Brandi, who could not attend today, but whose comments echo my concerns. This was a letter he addressed to you, Scott, because you're in his region. Should we hire car mechanics to fix our plumbing? Should we hire police officers to set our grant money allocations? Or should we just let state and federal dollars go to other Michigan counties? Why should the county citizens have the county board members decide when the public health is in danger or not? This is government overreach at its extreme. Staff is hired to run our health department. You need to figure out your role as its overseer. Show me when the staff is not providing us with results through problem solving and science. Don't show me when you don't agree with the policies of our health department by getting rid of staff so you can pretend to run the department yourself. Micromanagement is rooted in insecurity and fear of losing control. Micromanagement is excessive control or attention on details. Micromanagement kills morale of staff and the long-term ability to hire qualified professionals to run our department. I think the voters have lost control of you and what your governmental duties are as elected officials. Support your staff and ensure the long-term viability of our health department. That's what your goal should be. Thank you.
Ann Billiard.
Hello, I'm Ann Billiard from Littlefield Township in Emmett County. I think we can all agree that COVID-19 is uncharted territory. Nobody knew what to do. I think, and we knew it was killing people. So the health officials did what they felt was right at that time. Masking, mandating. I think we have forgotten. Unfortunately, I guess the other thing is that unfortunately, COVID-19 is a public health issue. It was made a political issue. It never, ever should have been made a political issue. We have forgotten as a people that in order to live in a free society, we have obligations as well as our freedoms. And these obligations sometimes override our freedoms. We have speed limit laws for a reason. I don't always agree with them, but I follow them most of the time. But we have to understand that we have obligations, and keeping our society, our people safe is an obligation. Please don't tie the hands of the health department. Listen to the officials. I don't know if any of you here have been trained in the medical field on the board. But you certainly do need to listen to the people in the health department who are medically trained and know what they're doing and take it from a non-political standpoint. Thank you.
Mary Moore.
Sir, Judith Kendall wants to know if she can give me her time. She was going to talk later. She's not on it.
I think she can give you that time after we've gone through everyone
3
else.
minutes now and 3 minutes
If she wants to donate her time at the end of the list, yes,
Or you want me to just wait till the end of it?
that's up to you. Well,
I'm happy to do that. That's no problem.
No, you know, if she's to be expedient, because I think we have a lot of folks that still want to address us, we'll give you her time here and I'll put her on the list.
6 minutes.
Yeah.
Pointed at your nose, they say. Right. All right, so Mary Moore, is that working?
Yes.
Taxpayer, Emmett County. I'm just going to throw my creds at you guys. I have a Stanford Law degree. I have a EE degree from Marquette University. I worked for Kirkland and Ellis. I litigated for them in Chicago, and I worked with experts, scientific experts on a daily basis. Just going to start my stopwatch, sorry. So that's where I'm coming from. I would posit to you that this resolution today, which I am in favor of, is not about negating the health department. It's not about micromanaging the health department, and it's not about punishing the health department. Rather, it's about restoring right order and proper balance to this community's most important type of decision-making, namely crisis or emergency decision-making, which some people have conceded doesn't actually happen all that often. Per the resolution, the health officer makes autonomous decisions for 28 days once an emergency is declared, and he or she has the sole authority to declare such an emergency. After such a time, then the officer must work with the board. This is entirely reasonable and entirely consistent with the Michigan Supreme Court's decision in re certified questions decided on October 2nd, 2020, wherein Governor Whitmer was told that she had to work with the legislature on any declared emergency that extended beyond 28 days. I agree with my friend Larry over here that this is the controlling law here. All that you are doing is implementing it at this local level. And I believe it's the controlling law, not only obviously for Governor Whitmer, but for MDHHS. She appoints the MDHHS directors. Remember, her first one during COVID resigned, and she abused their emergency powers in order to issue all of her orders. MDHHS has so far avoided appellate or Supreme Court review of this clear abuse of power, likely because they know they will lose in light not only of the 2020 decision, but also because more recently in the Iron Pig case, the Supreme Court said no to MDHHS's request that they revisit the in re certified questions case. All right, that's my first point. Restoration of proper government balance. Number two, the resolution trusts the republic model of government bequeathed to us by our founders. Those who want the health officer to be a dictator speak, I would believe, in haste and in fear and without sober consideration of the liberties that are at stake and without any trust in their elected representatives or in the concept of self-government. Number three, no one needs to be an expert in order to competently weigh the evidence and opinions offered by experts. And my kudos to this health department. You do have a number of wonderful experts here. Our court system proves this fact over and over again, or principle really, over again every single day as judges and juries do their jobs and weigh the testimony and the advice of experts. The same happens within the legislative and executive branches of our government. To say that the Board of Health is incapable of weighing evidence and helping to make decisions in an emergency situation is insulting to them. And I would argue insulting to every soldier that has ever fought and died or suffered injuries to uphold our right to self-govern. Number four, elected officials desperately need to be involved in public health emergency decisions, primarily because the public health experts during the last 3 years squandered the authority and trust that much of the public had heretofore placed in them. Pretty much nothing the experts told us during the pandemic turned out to be true. If one reads beyond the unbelievably heavily censored mainstream media, one learns the following. And I got a bunch of bullet points. The first one I'm adding, first of all, Norway, Denmark, the UK, Australia, and our state of Florida are heavily restricting these vaccines to people over 50 or 60 with comorbidities. And the UK in particular has told pregnant women not to get it. To me, this goes beyond any studies that you want to throw around. These are sovereign governments looking at the data and saying, no, the risk is higher than the reward. Okay, here are some other things that you learn if you read what I'm reading. The COVID virus did come from a lab, and it probably originated in a lab in North Carolina funded by NIH and NIAID. Key genetic sequences in the COVID virus were patented and discussed in articles at least 5 years before the pandemic occurred. Masking does not work and never worked to prevent transmission of respiratory viruses, including COVID. COVID, in fact, does not reside on surfaces like groceries and doorknobs for very long. COVID was never more lethal than the common flu, unless one was over 60 with comorbidities. COVID was never a threat to children and young people. COVID deaths were overreported by as much as 90% because hospitals and coroners were incentivized to not distinguish between those who died of COVID or with COVID. Hospital protocols killed people. Lockdowns and isolation killed people because the Great Barrington Declaration was suppressed and censored. COVID vaccines turned out to be not only ineffective, but possessed of negative effectiveness after about 3 shots. All right. They did not prevent transmission, and our CDC admitted that. The COVID vaccines turned out to be unsafe. I've talked about that frequently. Ed Dowd is the best source on that.
6 minutes.
Those who would give up essential liberty to purchase a little temporary safety will end up with neither liberty nor safety. Thanks.
I believe the next speaker is Madeline Levy, and I apologize if I've got that wrong. I'm having difficulty reading your name. It could be Maggie Lacey. Oh, okay. Thank you.
Hello, Maggie Lacey, Emmett County. Full disclosure, I do own an urgent care in California, so I do and have been given the experience of dealing through COVID, and I wanted to share that with you. When this first came out, of course, we worked with the health department. That was the number one thing we needed to do. I was up late in the evenings, early mornings, working with my medical directors, working with my staff, understanding. And to let you know, this was something that adapted day to day. We didn't have protective gear. We didn't have a lot of this information that we were treating at the cases when they were the worst. Okay. But yeah, we prevailed. We did everything that we needed to do, and we were troopers. When the vaccine came out, we had to adapt still. But the one thing came across that the health department was not adapting along with the new information that was coming out, especially how to treat early and to give preventative care if possible. Speaking of vitamin D, and why is that important is that if you look at the countries like India, when the Delta variant was out there, it was so much more at risk for people with diabetes. A majority of that population are diabetics. The government gave vitamin D. They gave ivermectin. Well, when this was coming through, we ended up testing all of our 30 employees, being pre-med students up to 75, age 70, one of my providers, and all of them were at low or extremely low in vitamin D. And this is in California where you get a lot of sun. We gave them vitamin D. None of them were getting sick. Okay, because we elevated their levels where it should be for vitamin D. It's a very inexpensive test. Vitamin D is very expensive. That's what we should have done, is adapted to understand what was happening in our community. You guys have 28 days, but once we had the 28 days, there was no early treatments. They wanted you to get sicker and sicker and go into the hospital. When we treated with our patients, we gave them vitamin D, we gave them zinc, we gave them vitamin C. I worked with restaurants. The whole restaurant was shut down. We tested everybody. We moved them through. We got them back into business. This was an economic attack also. You have to realize it was taking place. And we've seen it here currently in our own community. So when I talk about making sure you give us the ability to adapt, I'm a healthcare professional. I want to be able to go to the right sources, the top professionals, and really understand what to do. I don't want my health department to say, only you can do this. Because now in California, Doctors cannot prescribe. They wanted to write ivermectin and they
30
said no
seconds.
at the pharmacy level. That is when you know there is something wrong, when you cannot practice what you should be practicing that you love to do is nuts to help people.
Thank you. Betty Henny.
Good morning. My name is Betty Henny, and I am from Charlevoix County. I am here because I am deeply concerned about the resolution on the agenda this morning. And I totally oppose it. Department professionals and staff are best suited to make decisions on what safety measures are required. They base their decisions on medical expertise. I don't believe the board here has the same medical expertise. I have used the services of the health department many times for vaccinations and for information. They have helped to keep me safe. My husband safe, my family safe, my friends safe, and my community safe. I have a great deal of confidence in and respect for their informed decisions. For the health and safety of our communities, turn this political resolution down. The resolution undercuts the ability of trained healthcare professionals to protect all members of our community. For our protection, you must turn this resolution down. Keep us safe. Thank you.
Bill Henny.
I'm Bill Henny from Charlevoix County. And I hope you listen to my wife because I do. I was employed by the health department for 30 years in Emmett County. I've been retired for 20. And myself and my associates at the health department had a goal of that breaks down to help and protection. Help people and the environment and protect them. And I think that when people are appointed to the Board of Health, that these should also be your goals. I think there's at least one individual on the Board of Health who may have different goals. I have the impression because of this resolution that his goals are political and that they come from a minority group in our community, which is typical of a lot of groups in our country right now. And the sad thing about these groups is that they are undercutting democracy, and in fact, in some cases, trying to destroy democracy. And that's not only national, that it turns out that's on a local level. So if you're on the Board of Health, you have these underlying reasons that really should motivate you, and they just break down to help and protection. And when you vote on this resolution this morning, I hope you will keep those goals in mind and vote this resolution down. Thank you.
Cynthia Donahue. Okay, thank you. Jennifer Carroll.
Good morning. I could tell I was gonna have to lower this first thing. Okay. Hi, I'm Jennifer Carroll. I live in Antrim County. And it's been, at first, I just want to applaud everybody for providing this forum. It's been very interesting to hear the passionate feelings and political or not political, but just everybody's right to speak. And so thank you for this. And thank you also for all the professionals in the health department. I am not here. This is my first health department meeting. I actually rarely get up and speak in front of crowds anymore. And yet I was called to come here because of this feeling that people do have to do their jobs. And in the early days of the pandemic, when all of us were scared, and I'm not going to spend too much time because everybody has eloquently talked a lot about what we all went through, that suddenly I realized that this health department was here to provide outreach. The communications I thought were stellar, and I appreciated that very much. So I'm going to also then leap to a different kind of crisis, because obviously what's in front of us is the pandemic. I'm from Midland. My great-grandparents first came to Charlevoix in the 1850s. So I have very strong ties about this area. So I'm coming here as a neighbor and a friend. I have two close friends who are public health nurses in Midland. And about 20 years ago, they started talking about coordinating emergency responses. Worked very hard between the health department, law enforcement, the businesses in town. And I, of course, because a lot of that work is invisible to many people if they're not involved, I was very impressed how sincere and earnest they were. So during the pandemic, you may remember there was a flood in Sanford. The dam broke. And right away, I thought, I know the people in Charlevoix are going to want to help. And I'm going to get my husband's truck and I'm going to go down and bring everything I can. So people did respond. I was ready. I called and they said, oh, you don't have to do that anymore. We are coordinated. We are providing food for people who are homeless. We are helping. And if you can just donate money, that would be the best way. And then we will disperse it to everybody that we are helping. That just spoke volumes to me, because I do respect the health department. I don't have as much knowledge of the breadth of the work that they do. But I hope that I'm just going to join all of my neighbors here today and say I would urge you not to go in haste on any of the resolutions that you are considering. Thank you very much.
Thank you. Suzanne Skubic.
Good morning. One of the previous speakers spoke about the tyranny, being afraid of the tyranny. I too fear about the tyranny of the minority viewpoint that follows QAnon and other such fantastical rumors, suspicions, conspiracies. We need to trust in the professionals. If I was going to buy some farm equipment, would I go and consult a Florida police officer? I don't think so. That's not somebody that would be able to give me an informed opinion. So I just want to say, you should be voting no. You should be respecting the knowledge of our health professionals. And you should be respecting the need for good public health. If we lose good public health in the northern part of Michigan, eventually that will become known and people may choose to stay away. So I know a lot of people like to put things in the economic bottom line. We depend heavily on tourism. And what would happen to our tourism if suddenly we have our very own public health crisis due to people who don't know about medical issues trying to tell us what to do? Thank you very much.
Ladies and gentlemen, that concludes the list of people who had signed up to address the board. Would anyone else like to address the Board of Health? Please step forward, sir, state your name, and you'll have 3 minutes as well.
Won't take that long. Brenda Losgood, Otsego County. I would just like to say, I think the board should get a couple of retired positions that both the Public Health Department and you can agree on and depend on their opinions on this matter rather than your political agenda. Thank you.
Go ahead, ma'am. If you'd like to step up to the podium, please state your name and your county of residence. You'll have 3 minutes as well.
My name is Amy Carell. I'm the proud wife of Larry Carell. We've had the acquaintance of J.B. Williams with the North American Law Center for some time. It's not a new acquaintance, it's an old one. And we've seen him do some really good work. We appreciate what they've said about putting this particular resolution off until you can get the right wording. The wording should be non-political, but I don't know, in a day and age when so much is political, it's like telling a man it's drowning that he's not in water. We are drowning in political business. This is a political business, but it's also a health business. And you must state it. It's also a law business. You must state this in such a way that the law can't come back and rewrite what's been already decided. It was decided that our governor was wrong. It's been decided that health departments made mistakes. Doctors made mistakes. Remdesivir was called run quickly, death is near. We have a daughter who's a nurse. She saw a lot of this. My husband and I both got a really bad bug before it was announced in the country. It was here. We went to the local walk-in clinic. At the walk-in clinic, we took and put masks on because we knew it was a bad bug. They said, "Oh, you both have pneumonia in both lungs." Well, I had pneumonia once before and it was only in one lung. So I had pneumonia in both my lungs. We are elderly. We are considered the elderly part of the community. So they said, well, we'll give you an antibiotic. So they gave us an antibiotic. We went home and we rested for about 3 days and drank a lot of liquid and took our vitamin C and our zinc and our vitamin D, and we recovered. We recovered in about 2 weeks. We had a cough for a little while. We got over it. And then when they said this was a terrible bug, we just couldn't believe it. We said, we're elderly. We're the kind of people that should be in the hospital with it, and we weren't. So we had doubts about it from the very beginning. And then when Fauci kept flip-flopping about masks, we even had more questions. So because
30
I'm a
seconds.
lifelong learner and so is my husband a lifelong learner, we decided to research this whole thing. So we found as many opinions as we could find about it. And we decided this was done much too quickly. The vaccine came on much too quickly. I was 7 years old when polio hit the United States, and there were all kinds of research being done about polio. I lost a cousin to polio. I was 17 before I got my first polio vaccine.
8
That was
minutes.
10 years in the making of a vaccine.
Thank you, ma'am, but that is your time. Would anyone else like to address the Board of Health? Please state your name and your county of residence, sir.
John Morgan from Emmett County. I've heard a lot about overreach and about micromanagement. And that's exactly what we've seen in this country, in our state, in our community for the past 2 years. There's been way too much micromanagement. As far as the professionals I keep hearing about today, I do no longer trust the professionals that were wrong on masks. They were wrong on this shot. They've been wrong on the entire policy that they presented to us and forced us to adapt as individuals. This micromanagement has gone way, way too far. My main focus is our children. What this local Board of Health has done to our children in the schools in this community is tantamount to child abuse. It went on way too long. The risk of children in this, I'm talking children up to 18 years old, is technically zero for this disease as far as the numbers go. And we have subjected our children to this masking for years, and it is tantamount to child abuse. This sort of thing should never, ever happen to our community again, to our state again, to our country again. And it starts here at the local level with a common sense proposal like we have now. I'm all for more communication and more talking about these issues. But we need to have, I've heard so many things today from the professionals that are just absolute nonsense if you actually do your research. So I came here to support this. I wouldn't be, I would not object to maybe talking about it a little further, maybe not even voting on it today, maybe having a few more meetings like this where we can talk about this issue. I didn't read I don't know the proposal frontwards and backwards or anything. Just from what I read, it looked pretty good. There might be some tweaks necessary, but both sides could come together and maybe tweak it a little bit. But the bottom line, we should never, ever do what we did to our children again.
Would anyone else like to address the Board of Health? Yes, ma'am. Well, you're next. Go ahead. Go ahead, ma'am. Please state your name and your county of residence.
I'm Harriet McGraw. I'm from Emmett County, recently retired dentist in Harbor Springs. We went through the COVID restrictions, and I can tell you, I can't understand why there's this strong feeling saying that masks don't work. Why would doctors for years be using masks and the people in operating rooms be using masks if they didn't work? And, and it has been shown if you sneeze, you can launch, droplets 40 feet away. And during the pandemic, interestingly, while there was a mask mandate, the number of flu cases dropped dramatically. They went into the low thousands from hundreds of thousands. So the other thing that concerns me is we have our professionals in the health department. Just who do you think you would be able to replace them with? We are in a crisis right now in healthcare, be it nurses, be it physicians, be it dentists. We have a crisis here in Northern Michigan. We can't find care providers, and so who would like to come into this environment? Rather than working cooperatively, I'm seeing you work as adversaries, and I just don't understand. I support the gentleman who suggests that you meet in private with the health department and come to an understanding somehow. The other issue is the wanting to reject some of the grants. That's money from the state that would go to other counties or other
areas, but why not keep it here? It's not costing us anything. It's not like it would come back to us as some form of credit. That's money that's going to be spent. So I would ask you to please work with, your very qualified health department staff. These are good people. Thank you.
Yes, ma'am.
Marcy Beauchesne, Otsego County. Let me start by saying, you're right, this is a political issue. It became political as soon as a weapon was released on the American public. Okay, we know that now through the lies and through all the deception. So it is a political issue, make no bones about it. It is a monetary issue, make no bones about that. As far as flu rates going down, well, we all know everything was getting marked as COVID. I have relatives that passed away, not of COVID, but their physician said, oh, if you put down COVID, there's financial assistance. Okay, so a lot of people got this COVID designation when they died that were not COVID related at all. Some people died with COVID and not from COVID. This was a monetary pandemic, and make no bones about it, it was to cripple the American people. And that is exactly what it has done. And it's done the worst for our children. In Otsego County at Gaylord High School, students protested against the masks. They did a peaceful protest within their commons area, not infecting the other students that were still in class. They did their work in the commons area. The police were called on them. The police came. Thankfully, our county sheriff was allowing them to peacefully protest, but the city was also there. And the city decided to remove those children and deny them the education. Now, our lovely little town, our city, has decided to annex our high school into the city. This bothers me. The only person who stood up for those kids that were peacefully protesting was an Otsego County sheriff. He has now been stripped of his rights to respond unless called upon to our Gaylord Community School. So make no bones about this. This is all about the money. And as far as grants go, do you think there's some grant tree out there that's just dropping
30
money?
seconds.
No, it's coming out of your pocket, people. Come on, wake up.
Yes, ma'am. Please state your name and your county of residence.
Hello, my name is Rebecca Otto, and I'm in Emmett County. I also serve as the Director of Community Impact for United Way in this region. And in that role, I have also been the chair of the Charlevoix and Emmett County Human Services Coordinating Body through the last 3 years of the pandemic. In that time, I was able to work closely with not only the health department, but other human services agencies in our area, and saw the utmost respect in interagency cooperation, and also just a dedication to doing what was absolutely best in the face of something that was out of our control. I don't think that anybody in the health department or any other agency was working with nefarious intent. I don't think they were benefiting from any kind of financial windfall from any other place. I think they were just trying to do their best with something we had no experience in, and trying to make sure that our community was as safe as possible in something that was changing every day. I've had the chance before that to work with numerous departments within the health department. I've always known them to be working with the utmost integrity and trying to do what's best in light of changes in political landscape and ideology changes that come and go with elections that we've seen throughout our entire lifetimes. And they have stayed fast to the expert knowledge that they have and they possess in these areas, and have done their best to take care of us. I think that this resolution is dangerous territory towards not giving voice to the people who have the expert knowledge in what we're dealing with. Furthermore, I would love to invite you to meet with me privately, as I think a couple of citizens have said. I would love to educate you on the ALICE population and what those systemic challenges that came to light more with more urgency during the pandemic, what those actually are for the 4 counties that you serve in this health department, and give you some information about how that's changing. The 5th report of the ALICE report is coming out at the end of this month. This will be the first report that includes post-census information and post the start of the pandemic. We are very skeptical that the numbers will be encouraging. We fully anticipate that the numbers will be trending down, even as some of our areas were experiencing some positive growth and moving away from a large section of ALICE population. I think our counties have done a good job. We are below the state average for ALICE, which is good. And I think that speaks highly to the work that is done behind a lot of closed doors by a lot of really dedicated people in the human services sector. Thank you for your time.
Would anyone else like to address the Board of Health? Please state your name and your county of residence.
My name is Jan Mancinelli and I am from Emmett County. I've just heard a few alarming things here. I had COVID twice. I am not crippled. Whoever inferred that. People who had COVID, I think, were as frightened and as scared as anybody who was frightened and scared about their rights being tromped on because you had to wear a mask. I also had the pleasure throughout my career to work with the health department in various ways. Many of them were with the grants that came to this county or the 4 counties that provided wonderful services for women, children, families, and individuals. They are responsible with those grants that brought social workers in our schools when the schools could no longer afford it. They brought food and help with infants and young children as they were growing and forming the kinds of health habits, hopefully, that would take them through the rest of their life to be safe. I know that those grants come into this county, and I know that if we stop them, you're not going to see money in your pocket from the taxes that are being charged or that are being given to provide those grants. This proposal that is before you today about the right to turn down or turn away after 28 days any edict that the health department possesses. Because I worked with them so long, I understand, know in my heart, and really respect the professionalism, the education, and the things that they brought to the table and to our counties for over the 40-some years that I spent in human services. I think it would be a mistake by any commission to micromanage them and not let them do their jobs. They are incredible, the things that they have accomplished. And we, as a community in all 4 counties, because I worked for an organization that served all those counties, we are very, very fortunate to have had them in the human service network and in our health network
30 seconds
throughout those 40 years. Thank you.
Would anyone else like to address the Board of Health? Anyone else want to address the Board of Health? You'll have an opportunity again at the end of the meeting, but I'm about to close public comment. You've been forewarned. Okay, public comment is now closed. Ladies and gentlemen, we've been sitting for 1 hour and 41 minutes, and I need to stretch my legs. There are restrooms on the sides and up near the front, where we're going to take a 10-minute recess, and we'll be back here at approximately 11:40. Well, John.
and then go ahead and maximize that. Right there, and then go ahead and mute.
We're back or close to back, so we can call this back into order. Actually, I was hoping most of the board members didn't get in their cars and go to a drive-through somewhere. Yeah. All right, it is, I believe, 11:54. We'll call the meeting back to order. On a complete side note, I appreciate the fact, regardless of what side you fall on, or regardless of what your opinion is, I appreciate the fact that so many people turn out for our meeting. Because it is important as American citizens that you do make your voices heard to your governing bodies. So thank you for your time and attention this morning. That's an important thing. And now we move on to a financial audit report. Corinne, are you presenting?
Well, good morning, everyone. Is it still morning? Almost morning, almost afternoon. Good morning. My name is Corinne Perot. I'm an audit senior manager with Dennis Gartland Nairgarth. We'll be reviewing your financial audit package with you briefly. I'll keep it light so you can keep going here. So let's start with, you should have a bound copy in front of you. You were also emailed copies of the financial audit in advance of the meeting with the audited financial statements and the independent auditor's report. I believe we're going to be pulling this up here on the big screen. If you don't look at your hard copies in front of you, we're going to flip in to Roman numeral page number 3, which the page numbers are on the bottom. So we're going to review a quick financial highlight of the of the health department. And so I'll focus on the 2022 column here. This is a summary of your statement of net position, which is effectively your balance sheet for the year ended September 30th, 2022. So total assets for the health department were the 10.4 million. And that's going to include your cash, your receivables, your capital assets owned by the department as well. Your total liabilities came at the 6.2 million. That's going to include your payables, accrued liabilities, your pension liability, your lease obligations. Those components are included in that total there. And then your total net position, which is effectively your year-end accumulated earnings, that's the 3.8 million. So we do have an asterisk there on the 2021 column, and that's related to a new accounting standard that was implemented in the year, required to be implemented in relation to leases. That was so the 2022 data is not necessarily comparative to 2021, and that's going to account for some of those really big increases from 2021 that you may see in those totals. So just to make you aware, that is noted there at the bottom of that first table, that at footnote B in the financial statements is more detail on that new accounting standard and the impact on these financial statements. Going down into the next table here, still on Roman numeral page 3, total revenues for the department for 2022 were the 31 million. And that was an increase of about 2.4 million over 2021. Total expenses for the health department were the 31 million. And that was about a $3 million increase over 2021. And then your change in net position, which is effectively your net income for the health department for the year, was a deficit at $344,000. And that ends up being about a $599,000 swing from 2021, which had a positive net result of about $255,000. Are there any questions there?
Yeah, ma'am.
Yes.
We have at the health department, we have something called Dental Clinics North,
Mhm.
and it's a fairly resource. There's a lot of money involved in it. Is that included in these numbers?
The contractual relationship with the health department, or I'm sorry, with Dental Clinics North is included as a part of some of the expenses. The paying for the payroll and the pieces that are a part of that included in that contract, yes, are incorporated here. But the Dental Clinics North is a separate entity and has its own revenue sources and streams that are not included in these financial statements. Any other questions I can answer? All right, then we can keep flipping here. We're going to move to what is footed as page number 2, towards the bottom. So this is going to be headed as the independent auditor's report. It's going to be on our letterhead. So bear with me, there's a lot of boilerplate language in here, and I will not, of course, focus on all of this, but touch on some highlights for you. So our opinion paragraph is here at the top. So I will read a little bit. So in the second paragraph here, in our opinion, the financial statements referred to above present fairly in all material respects the respective financial position of the governmental activities, the major fund and aggregate other fund information of the Health Department of Northwest Michigan as of September 30th, 2022, in accordance with GAAP. So what that long sentence is boils down to is that's considered an unmodified opinion, which is a clean opinion and the highest level of assurance that we can provide on a set of financial statements. So we do commend the department again for achieving that level of assurance on these financial statements another year in a row. Towards the bottom of that page, we do remind you that management is responsible for the preparation and fair presentation of these financial statements. And flipping over to page number 3, our responsibility as your auditors is to obtain reasonable assurance about whether or not these financial statements are free of material misstatement. There are other highlights that we have to take into account as a part of our audit procedures. Flipping over to page number 4, we do highlight again that change in accounting principle in relation to leases, and that is further detailed on page 18 of these financial statements if you're interested in looking at that further. We also talk about the required supplementary information that's included in these financial statements. That's going to begin on pages 31, and that's going to be your budgetary comparison schedules, your pension funding schedules, and then also your supplementary information that starts on page 35 of the financial statements. This is mostly in relation to your federal single audit, which is your audit of federal dollars received and expended in the year. Any questions there? So if you want to flip quickly to page number 18 in these financial statements, again, the page number is at the bottom. It's going to be note B, change in accounting principle. This here is the impact of that new lease standard that was required to be implemented for this year. So that total leased assets that added 3.1 million to your balance sheet, and then also a lease liability of 3.1 million as well to your balance sheet. No further questions there. We can flip over to the graphs, which were handed out separately to you. Should have a header page right on them that says graphs, I believe. Let's see. So the first page in here is going to be your ratio of fund balance to fund expenditures. So this is where the graphs are a nice presentation to be able to digest some of the financial changes over the years and give some historical trends of data here. So this first graph, the ratio of fund balance to fund expenditures, really showcases that fund balance has been pretty stable over the last 5 years or so, ranging between 14 to 18%, or pretty consistently over the last 5 years. Flipping over to the next page is going to be a revenue trend graph. So this is going to showcase the movement of your revenue sources over, let's see, the last 6 years. So you can see sort of the impact of COVID as it hit in 2020, the line there in the top, the red, that's going to be your charges for services. That's going to primarily include your Medicaid dollars. And then also the sort of the rebound of that as we come out of the COVID impact and returning of services in 2021 and 2022, you can see how those have rebounded. So total charges for services revenues were the 14.6 million. State and federal dollars were 11.3 million. The other category, which I realize is a little hidden behind our legend here, but that's about 4 million. And then local sources are there at the bottom in the purple, pretty flat. And that was about 1 million. Flipping, oh, yes.
I do have a question.
Sure.
Page number 16 talks about fund equity.
Yes.
And the second paragraph towards the bottom. Department will maintain a minimum fund balance sufficient to provide operating cash flow equal to and no less than 2 months of regular operating expenditures based on prior year budget. I just wanted you to know that the board changed that and it's 1.85 months now.
Okay.
And I was curious if that changes any of our graphs or other things in a substantial way or not.
I believe, Jairus, I believe that was a temporary change, and I'm not sure that we're still there. Dan, can you,
There was a timeline on that. But I don't recall. I believe that it went through this fiscal year. Andrea's nodding her head.
okay, okay,
Yeah,
thank
so it
you.
does
I knew it was temporary. I wasn't sure how long.
Right. So I believe it ends September 30th, 2023. But
Okay,
yes, it
thank
was
you.
Changed
Thanks.
to 1.85 months. or like.
All right, we can flip back then to the graph. So the next graph we will look at is the expenditure trends. So this showcases your movement of expenditure sources over the last 6 years. So personnel, there is the line in blue, personnel services, and that's going to include wages, taxes, benefits, all those personnel related costs. And that was 14.9 million. Contractual services, which is going to include the Dental Clinics North components, that's the 9.5 million. And then supplies is the next line down there in the red with the red squares, and that's about 3 million for the year. Next graph over is revenue and expenditures titled. And so this is kind of the alignment of revenue and expenditures and where that impacts your net income effectively for the year. So it's a little hard to see because the numbers are actually very close, but also I'm sorry, revenues, expenses end up being very close in relation to the total dollars that are expended in each of those categories. So for 2022, there was about $188,000 net loss. So expenditures were a little over revenues received in 2022. Next graph over is revenues, comparison of budget and actual, and also a comparison to 2021 actual. So your actual columns are in red and your budget is in yellow. So actual federal and state grants came in at about 11.3 million, and that was under budget. Grants from local sources came in about 1.1. Charges for services came in about 14.6 million, and that was over budget. And then your other category, which is include other grants, interest earnings, those sort of things, came in about 4 million. And that was significantly over budget for the year. Next graph over is going to be expenditures, budget and actual. So just touch on some of the highlights again. Your 2022 actual is in red. So personnel services came in at 14.9 million, and that was over budget. And supplies came in about 3 million, and that is under budget. And then also contractual services came in slightly over budget, and that was a total of 9.5 million. And these overages are required to be disclosed and are disclosed in the financial statements as they, for auditing standards, they are reported there in note C, it looks like, of the financial statements. Well, and actually, that's the last one. Can I answer any questions on the financial statements? Yes.
I do have a question on page 32 of the book. Can you tell me what the unfunded pension amount is there?
Yes, so this is based on actuarial determinations for the health department. The health department participates in the MERS pension plan. And so these numbers are specific to the employees and retirees of the health department. And so the total pension liability that is outstanding is a 7.4 million for 2021. This is based on the actuarial's fiscal year, and that's why it feels like it's a year behind.
Right. Do you know the percentage of that?
Oh,
it doesn't have it in here.
If you flip over to the next page, is also going to be additional detail here. And so the funded portion is the 88%.
Okay, that's my question. Thank you.
Yep. Any further questions on the financial statements that I can answer?
Yeah, page 34. Under 2020. Contributions as a percentage of covered employee payroll. You've got it circled there. Just wondering, 292%. It's really high. Just wondering why, or if we know what's behind that number.
Again, these are based on the actuarial determinations. So we review this information, but it's based on what the actuaries come up with and it gets incorporated into our audit. So in the year, the covered payroll, let's see, contributions as percentage of covered payroll. So the contributions of the 520,000 in order to help fund that pension liability and bring those numbers down as much as possible. That's the ratio of 292% of the covered payroll that's coming into the system from active employees. Any further questions? I'm going to turn it over to Trina Oakes, who's our partner on this audit, and she will review your audit-related communications letter. Thank you.
Thanks, Corinne.
Good afternoon, everyone. So you have a separate letter inside the bound audit report called the audit related communication letter. And these are required communications that we have to have to those charged with governance at the completion of any audit. So you'll hear us report about the same things year after year in this letter. So the first page talks about compliance and internal controls, and that's really your policies and procedures at the department. And during the course of our audit, we also have to look at policies and procedures over your federal funding specific to programs that we are testing in accordance with the Single Audit Act. So if we have any findings related to those, we report those in this letter, and there's a separate letter in the back of the financial statements that includes those. So we did have one finding related specifically to one federal grant. It was a reporting finding. So there's two reporting options. It was under provider relief funds. So the reporting options were actual expenses or lost revenues. The health department actually had lost revenues, but reported under actual expenses. There was no change. You still spent all the money for applicable sources. So we did have to report a finding for that, but that was the only finding we had. We did not have any general policy and procedure findings during the course of the audit. On the second page, we list some additional matters, which are just general recommendations. So the health department does present an internal service fund for employee PTO in these financial statements. Those are required by government auditing standards to be a separate fund, a self-balancing fund. The health department includes that with the actual operating fund, and we segregate it out for the audit. So we recommend that you actually create a separate fund and account for that in a separate fund moving forward. And then budget amendments, as Corinne already mentioned, there were a couple of line items that were over budget for the year, and those have been disclosed in accordance with the required standards. Under qualitative aspects of accounting practices, the accounting policies are in note A to the financial statements. The health department did adopt that new standard for leases this year, which required a additional leases be recorded on the face of the financial statements. So leased assets and then offsetting lease liabilities. As far as transactions, we found that everything was recorded in accordance with principles and reported in the proper year. On page 3, this lists several estimates that are used in the financial statements, including the allocation of costs among departments, the final cost settlements and how those, how collectible those are to the departments, revenues and related charges for services and how those are collectible for the departments, depreciation, estimate for paid time off, and the pension liability. So we looked at the underlying factors used to develop those estimates and found that everything was reasonable. As far as significant disclosures, we mentioned several on the bottom of the page here. So note J for accumulated accrued benefits, note H for lease liabilities, note J for the defined benefit pension plan, the net pension liability, and then the pension expense and deferred inflows and outflows. On the top of page 4, we had no difficulties in performing the audits. We had one unposted adjustment was related to printer leases. Those were minor, only $30,000. So those were not recorded under that new accounting standard. We had no disagreements with management, no consultations with other accountants. On page 5, there is a new reporting standard that is applicable for fiscal year 2023 that you're in right now. It's called subscription-based technology arrangements, and it's very similar to the lease standard, except for multi-year leased software costs. So it requires the department to look at those kind of contracts and accumulate a liability and an asset, and record those directly on the face of the statements. So this could affect things like Microsoft Office, electronic health records, any sort of software where you're paying a multi-year fee to use that software. Under other matters, as Corinne mentioned, we did look at the required supplementary information, including those budgetary comparison schedules, the schedule of expenditures of federal awards, compared those to the underlying records and found that they were fairly presented. And with that, I'll ask if there's any questions on anything.
Yeah, and this might be for Corinne, I'm not sure, but it's on page 19. It's listed under bank deposits. It says, in the event of a bank failure, the health department's uninsured bank deposits may not be returned to it. As of September 30, 842,000 of the health department's bank deposits were exposed to custodial credit risk because they were uninsured and uncollateralized. And I'm just curious, I'm sure you do lots of other audits, and with recent bank failures, it's on people's minds. You know, we'd like to be insured. Just curious what your thought is on this.
It's so governments, you're absolutely right. It is on people's minds. We've been getting calls about it. Governments receive $250,000 of insurance on like checking accounts and $250,000 on limited withdrawal accounts, so savings and money market funds. So potentially up to $500,000 per bank. When you're talking about such a large volume of expenses and revenues, sometimes governments will go, well, in general, people will go over that insurance limit because you have to have enough money in the bank to make your payroll every couple of weeks to do your check runs. So that actually is a very small amount compared to what we see in some other governments. So I think the health department is doing a good job of trying to collateralize and ensure what they can. You have to balance that with being able to run your paychecks and run your accounts payable on a regular basis without having to scramble to transfer money every time you do that.
Yeah, our monthly pay runs are a lot of times over $600,000. So
it's going to be more than your insurance.
Right.
Mhm. Good question. Any other questions?
Any other questions for the audit staff?
All right, thank you.
Hearing none. Thank you, ladies. Okay. Reimbursement coordinator position reclassification, Mr. Thorell.
Yes, thanks. So the reason this is on the agenda is because anytime we have a change in our classification schedule, or, we change positions one way or the other, as far as, adding positions or deleting positions, or just wanting to move from one classification to another as far as pay goes, which is the case here. We need to bring it to the Board of Health and have them vote on it for their consideration. So basically, I'm sure you probably don't hear this too often, but we want to lower a classification for a job. So, and the reason is because, in this, it's for medical and dental billers, and this is a reimbursement coordinator. And at one time, this reimbursement coordinator had much more responsibilities, and that's why it was a higher pay for that position. But since then, we've reorganized a little bit over the years, and we have some supervisors that fill those roles. And so we want to basically we rescored the position going through our process, and with that into consideration, and it actually lowered it down to a salary level 8, coming from a 9. So which it will decrease salary from $60,861 to $56,077 annually. That is basically the gist of it. And we just asked that we could, have a vote to approve that move in classification. Unless
Anyone
anybody
have
has
any-
any questions, right?
Well, does anyone have any questions for Dane regarding this request? Hearing none, there is some sample suggested motion language on that same sheet. And I would entertain a motion to adopt this recommendation.
I'll make a motion to change the reimbursement coordinator position from a salary classification level 9 to a level 8 per the Health Department of Northwest Michigan salary classification schedule effective immediately.
I will second.
We have a motion by Ms. Levanway and a second by Mr. Chamberlain. Is there any further discussion? Oh, I'm sorry. It was Mr. Ginnett. My bad. Apologize for that, Rich. Any further discussion? Give a roll call, please.
Yes. Sorry.
Yes.
Melanie, you're very quiet. If you can make sure that's on so we can hear you.
Battery ran.
There you go.
Commissioner Ginnett,
Yes.
Commissioner Rubing,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hinkins.
Yes.
Motion passed.
All right. Thank you.
This one.
Mr. Mason didn't get to vote. But the motion passed regardless. Henry.
Commissioner Mason,
Yes.
We'll make that part of it.
Okay. All right. Item number 10, discussion of Board of Health resolution regarding COVID-19 countermeasures presented by Mr. Ginnett. Mr. Ginnett.
So I've asked my fellow commissioner from Emmett County to read the proposal and it was a resolution and then we'll discuss it after that.
I'm not sure we can hear you either, Rich, if you can make sure that that's on. Go ahead and slide those mics right up close to you guys. I know that sometimes.
They're amount of solids.
Yeah,
that
you're
better?
not done. Okay.
Go ahead, Mr. Chair.
You can read you can read the proposed resolution.
Whereas we elected officials have solemnly sworn an oath to uphold the Constitution of the United States of America, which was ordained and established to promote the general welfare and secure the blessings of liberty to ourselves and our posterity. Whereas we elected officials now recognize that the past 3 years of government-driven countermeasures to the COVID-19 pandemic have had significant adverse effects on the general welfare and the blessings of liberty for our citizens, manifested, for example, by the closures of small businesses, by the record inflation and economic devastation we are experiencing across our state and country, and by the deterioration of mental health among our young people. Whereas we elected officials now recognize that it is an essential to the promotion of the general welfare and to securing the blessings of liberty, that going forward, certain rights and freedoms of our citizens be better protected in a pandemic or epidemic of other emergency situation, including the sacred, inalienable human and legal rights of our adult citizens, acting on their own behalf and on the behalf of their children, to enjoy freedom of assembly, freedom of speech, the freedom to direct the upbringing and education of their children, the right to medical privacy, and the right to make autonomous choices regarding health care in accordance with the principles of informed consent, including in the context of a genuine doctor-patient relationship unthreatened by censorship or suppression. Therefore, any and all state or local governmental emergency measures affecting or emanating from the Health Department of Northwest Michigan or its territory regarding a pandemic or epidemic shall expire after 28 calendar days at 12:01 a.m. on the 29th day. And after expiration, only a 3/4 vote of the full Board of Health can authorize continued implementation of such measures, and then only on a month basis. Excuse me. Therefore, in connection with all public or private gatherings and public transportation within the jurisdiction of this health department and all employment relationships therein, the health department shall not impose, permit, or enforce COVID vaccine mandates, the mandated masking or testing of asymptomatic persons, or any vaccine passport type of system, and no outdoor masking shall be imposed or enforced. Therefore, all health department messaging related to COVID-19 vaccination shall henceforth advise citizens to discuss the risks and benefits of the same with their chosen healthcare provider. Therefore, all medical professionals within the jurisdiction of the health department shall be free to discuss and critique all public health activities, directives, guidelines, and recommendations, whether emanating from the WHO, HHS, CDC, NIH, MDHHS, HDNM, or otherwise. And notwithstanding these, shall be free to advise their patients and prescribe medical treatments for their patients in accordance with their own lawful best medical judgments. Therefore, the Board of Health recommends that its chair consider forwarding a copy of this resolution to the chairpersons of the county level boards or their equivalents at each of the counties in the state of Michigan, inviting them to consider whether passing a similar resolution might be in the best interest of their own citizens. Therefore, if any phase or portion of this resolution is ever declared unlawful by a court or legislature having the proper authority to do so, it shall be struck, and the remainder of the resolution shall continue in force and effect. Therefore, it is acknowledged that certain activities may be required under state and federal law or other pre-existing contract, and such obligatory situations are not affected by this resolution.
Thank you, Mr. Mapes. So before we move on to discussion, well, actually, this is listed on our agenda as simply discussion. I don't know if I would assume that that it's your goal to have a vote on this resolution today.
It is, yes.
Okay, so before we can move on to further discussion, we need a motion and a second.
I would like to make a motion to approve resolution 2 of 2023. Northwest Michigan Board of Health Resolution upholding medical freedom in light of recent COVID-19 countermeasure experience.
Moved by Mr. Rubing,
And I'll second that.
seconded by Mr. Ginup. Now we can have discussion. Ms. Levanway.
I would like to amend that motion to table this resolution until the health department attorney takes a look at this. I understand he did not look at this. And I think there has been much discussion in the audience from people today, whether they're for this or against this resolution, that has been obvious from people here that it may not be legal for this health department to make that decision. And I would like to hear it from the attorney, because if there ends up a lawsuit, the attorney is representing us.
Okay, actually, our attorney is present and I think he has reviewed this resolution. Matt, you want to?
But let me go back.
Okay,
I would prefer that he would put something in writing, just for the simple fact that every year the health department gets new board members, and we want to have to keep going back every single year asking for the legal opinion. And I do know that previously we've had different department heads, different directors, a different attorney. And I would like to have something in writing so that if another resolution comes up with this same intention, that you'd be able to hand it to the board.
okay, so that's a long amendment. I
can make it shorter if you want.
no, I understand.
Is somebody going to second it?
Second it.
Seconded by Mr. Chamberlain, so we can have discussion there as well. I think a written opinion by our attorney is probably a wise move, in my own opinion. I know that he has reviewed this resolution, and I think he's prepared to address it some, but I think to have the written opinion is perhaps
Saving us money.
I think that Mr. Rubing.
Yeah, I would like to have our attorney, if he's read it, I'd like to hear what he says, and it sounds like he's read it, so I'd like to hear what he's come up with.
Mr. Chairman, I would agree with that.
All right, Mr. Mason, thank you. Matt, I'm going to ask you again. You've been a very patient young man. Step on up here and
But that still doesn't change my motion. I want it in writing.
understood.
All right, well, it's sort of your call. I mean, you guys want to ask me questions? You want me to just launch into my thoughts on the, you hearing me?
Yeah, you're on. You can maybe aim it up a little bit, but so Ms. Moore brings up an interesting point. That if we were to, I think because we potentially would have to go, because this would be an attorney-client privileged conversation, we would probably have to go into closed session to do so. But that would require him, for us to go into closed session, I believe that would require the written opinion. So,
I just want to make a motion that you bring it back to us in writing. I can wait till next month. Are we in a dire need to have this done now? We can't wait.
I seconded your motion. So,
I thought Josh did.
wait, Josh, you know what? One of us did from Charlevoix.
I think it would be more appropriate.
Yeah, and it's for what it's worth. I mean, you could waive privilege and have me discuss it in the context of this, in the setting of this public meeting, but that's your call. I mean, that bell can't be unrung if we have that conversation today in front of everyone. So I can issue the opinion letter. We can go into closed session and discuss it. And then at that point, if you want to waive privilege and have some discussion during a public meeting, we could do that too. So it's really your call. I have reviewed it. It really boils down to a pretty simple premise for me, and I'm prepared to talk about it today, or we could do it at a later date.
Sir, can I ask you, do they have to vote on my amended motion first?
I don't even know if I would consider what you propose as an amended motion. I would say it's
Amended
a
the
different-
motion.
I would say
Yes,
it's a separate motion altogether. but,
right.
That said, I mean, if you want to put two motions up for the board to vote on, see where the numbers lie, if we want to discuss it today or table it.
Because I think if you table a motion and you get a second, you have to vote on it.
Okay. So before we get too far off in the woods on motions and counter motions and I have to pull up my Robert's Rules for Dummies, which I qualify to read. We have, I think we have to address Mr. Rubing's motion first. I personally, I don't think we should. Thank you, sir. So we have Ms. Levanway's motion then.
That I want his opinion in writing and I can wait till the next board meeting. And if you feel uncomfortable giving us that opinion, I would give Dan the authority to go to the Attorney General if he needs that opinion.
I have no problem giving that
Okay.
opinion. I'll give it here if you want it. It doesn't matter to me.
Mr. Chairman, I'd like to hear it here. I'd like to see us move on if we can.
But that's not my motion.
Well,
Okay. So
And it's been seconded.
it has been seconded, it's been moved and seconded that we don't act on the first motion until we have a written opinion from our attorney. Is that a proper
Correct.
paraphrase? Okay. Mr. Rubin,
Are we having discussion on that now, or?
we're having discussion on Ms. Levanway's
Yes.
motion.
So her motion is basically to table.
To table it and have a written opinion.
I'm ready. I'm fully prepared to move forward with this. I think we got the public here. We've heard what they want. The voters in my district have made it very clear to me that they are very much in favor of this. And we've got our attorney here. He said that he's willing to discuss it if we want to, but I would speak against the motion to table.
But if you put it in writing, Jairus, we have it in
We can
writing
still put it in
forever.
writing. There's no reason it can't go in writing this afternoon.
So why would you vote on something that you don't have the legal opinion in writing from an attorney?
Sounds to me like he's willing to share that with us.
But then we don't have it in writing. So now we have to pay again for the next 3 years. When it can be put in writing and everybody can use it forever.
I'm confused.
I agree with Jairus. That comes after the vote. We could have this vote on the table now and see where we come down. If you don't win the table, he can discuss and we move on.
I need to go back to the attorney. I made an amendment to the motion. Do they not have to vote on that?
We should vote on the motion to table. If it fails, then I suppose
Then we go back to the first motion.
Right.
Okay, so I'm going to call the question on the motion to table until we have a written opinion from our attorney. And so we're clear, an affirmative or yes vote would be to table this resolution until we have a written opinion from our attorney.
Correct.
I think I've restated that properly. You have questions, sir?
Hey, I have a question. If, I'm not a lawyer, obviously, not a medical doctor either. Openly admit that. I'm new to all this stuff. We're getting ready to vote on a motion. Our attorney is standing there ready and willing to communicate what our standing on this resolution is. I'm not sure by tabling this, it would make any difference. He can still put in writing at a later date or even before he leaves the building today, what he's about to share with us. So what am I missing? Before I vote, I want to know what I'm voting on.
Right. So what we're voting on would be Ms. Levanway's motion to table this resolution motion until we have a written opinion from our attorney. The reason for that is there may be it could potentially lead to a closed session discussion in an attorney-client conversation.
Well, I'm not opposed to that either, if that's what everybody feels is necessary for us to have a closed session, so we know what it is we're voting on or how much trouble we could actually get into.
Well, and if I may, I think what we're getting at is kind of defeats the purpose. If I say my opinion now, then give you a written opinion letter and we talk about it in closed session. I've already waived privilege. I've already expressed my opinion in a public meeting. So just a question of whether you would rather have this conversation amongst just the board and myself, or whether you want to air it out now. And that's a call that you all have to make. So those are the options. I mean, we table it, you get a written opinion, we go into closed session and discuss. We can even come out of closed session and talk about, summarize what we said in closed session, if that's what you want to do. But
So if we were to vote no against this motion, we could still have that.
you could, but again, if we have the conversation now, opinion letter and the closed session are.
But there's no reason we couldn't vote to go into closed session after we.
Yeah, I'm just trying to figure out where all this ends. Or, are we just at the beginning? I guess.
We finish off the issue of closed session with this vote.
If we vote.
And then we're left to his opinion and the final vote to support or deny the resolution. That would be after the vote on Commissioner Levanway's.
We still have the option to vote to go into closed session.
Unless we were to table the first motion. I mean, we could still go into closed session then, yes.
You might want to ask the attorney if it's qualified for the closed session.
I don't think without a written opinion, we wouldn't be able to go into closed session.
Right. You need the opinion letter because there is an OMA exception to discuss privileged material. attorney-client letters are privileged. So
Right. So we don't have the option, if we don't table on Ms. Levanway's motion, we don't have the option to go into closed session today because we don't have the written opinion. And that's one of the exceptions to the Open Meetings Act.
I understand.
Any further conversation
Thank you.
about, yeah, absolutely. Okay, so I hope I can paraphrase this right again. The motion before us right now, made by Ms. Levanway, seconded by Mr. Chamberlain, would be to table the resolution motion until we have a written opinion from our attorney. A yes vote would be to table that initial resolution motion. Did I get that straight?
Correct.
Okay. That was moved and seconded by Mr. Chamberlain. Is there any further discussion? Okay. Call the roll, please, Mel.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Hankins,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
No.
Commissioner Mason,
No.
Commissioner Ginup,
no.
Commissioner Rubin.
No.
Motion passed.
No, I think we're
No.
4-4.
The opposite.
Motion
Four
passed.
to four, so the motion failed. Which brings us back to the initial motion, which was made, I believe, by Mr. Rubin, seconded by Mr. Ginup. That's the consideration of the resolution that was presented by Mr. Ginup and read by Mr. Mapes into the record. Now we'll have discussion on that. And I have a number of questions myself, but I'm going to open it up to the board for conversation, for discussion. Who wants to go first? Mr. Rubin, you got your hand up first. Go ahead, sir.
All right. Well, just reading through the resolution, I mean, it seems pretty common sense and pretty straightforward. It references the Constitution in various places. I think that the whole gist of it is, if we value liberty and freedom, then government has to be small and it has to be limited. And that's the whole purpose and intent of this. And it really emphasizes people using the sense that God has given them to make common sense common sense decisions and common sense treatments that they make with their doctor. So I'm fully in support of it.
Okay. Wants to go next? Ms. Levanway. Do you have any?
I just have the opinion that I would like an attorney's opinion before I make a decision.
Okay.
Don't know. I don't think it's legal.
Okay,
And does the board want me to opine on that now?
not yet, sir.
No.
Thank you. Mr. Ginup.
I think it's self-explanatory.
Okay. Mr. Mapes.
I support the resolution. I'm thankful for all the input that we've had this morning. Both sides. I apologize. I wasn't clapping for both sides. I realized what I was doing. It was out of being a rookie. I didn't mean to offend anybody by not clapping for, toward their comments when I did some others. That wasn't my intention. When people told me I didn't know what I was getting into, I didn't know what I was getting into. But I received an email from one of my constituents listing probably at least 20 communicable diseases that we've had since as far back as like 1917. And I was just curious, really, how many of those had mandated components to that. You know, because I can remember growing up as a young man, when Congress was getting ready to pass a bill, they always questioned themselves, well, what does the Constitution say? You know, does the Constitution stop us from doing certain things, you know, that would affect people's rights and liberties or not? And not one of those diseases had that component. But what components those diseases did have was, yes, a lot of people died from those diseases. And yes, the vaccinations that came from those diseases saved a lot of lives. But most of those vaccinations, virtually all of them actually, except for, I can't even say there's any exceptions at this point, came 5 to 10 years after the disease. I also ran across an article from the CDC dated in October of 2020, talking about the Asian flu, and the same scenario pretty much rang true on that one as we're looking at. We were faced with the COVID, where the president was forced, at that time it was President Ford, was forced to make a decision and made some decisions that, as CNN calls it, were totally stupid. So I support this resolution because of that. This one here is infringed on constitutional rights and liberties of Americans. We're speaking specifically state residents, and unfortunately local residents as well were affected by that. That is why I support this resolution.
Thank you, sir. Mr. Chamberlain.
Thanks, Scott. The biggest thing I had concern with is the position it's going to put Dan in. You know, he's going to have to go between the health code and this if it passes, and I just don't think that's right. And that's about my big issue with it, if it's even legal.
Okay. Mr. Mason.
Well, I support this because, well, for many reasons, but certainly we as a board are here as a checks and balance. And if we cannot make decisions like this, then what are we left here for? Mr. Chairman.
Thank you, Mr. Mason. Mr. Turnbull.
Yes, my thoughts on it are similar to Commissioner Mason in that checks and balances, everything in government. I mean, there's checks and balances on everything from our president on down to here. And I know I spoke to 20 people within Otsego County specifically about this, had them read through the resolution, and I asked them, what do you think? And the important person that I spoke to was my personal doctor. And as a doctor that's worked for Otsego Memorial Hospital for the last 20 years, has recently moved on to private practice. I asked him, I was like, what do you think how this should be? And he said, the health department, they're really good at this broad spectrum, you know, overarching things to help protect our citizens, which is important. He says, but they don't know the individual. They're not able to make the decisions for the individual. So he recommended that I move forward with this and pass it, and that they it opens communication opens a dialogue between Dan and ourselves, but also the communications between ourselves, the commissioners, and the people, in that if there's something that needs to be done for the health and safety of our people, then the health department will advise, hey, we need this to be done. This should be done. And the communication with us would be fantastic. That way we can relay it down. That way it's not a surprise to the people, but they're advising everybody's primary care doctors, hey, this should be done, and this is why. And I think the support for it would be far greater for vaccines, for masking, all these, when your personal doctor is telling you to do it and it's not coming from the government. So I say this as just to echo Commissioner Mason, in that the checks and balances are needed, but I also reference my prior comment when we were discussing the grants. that it is important to maintain open dialogue between the health department and the Board of Health. And that way we can maintain communication between the people and the governing body. So thank you.
Thank you, sir. So,
Mr. Chairman,
sir,
I'd like to say something if I could.
yes. Well, I'll reserve my comments for after yours and then perhaps have our attorney weigh in as well. Go ahead, Dean.
Yeah, great. First of all, I have a great deal of respect for everybody serving on this board and appreciate their service. This resolution, it's being proposed at a time when COVID is fading and we're trying to heal and move on as a community. Regardless of your political beliefs or position in life, the pandemic, was hardship on everybody. And I can say that from firsthand experience, and it was a hardship on health department staff. Many spent, worked 80 hours a week. They racked up a ton of vacation time because they weren't taking time off for 2 years, basically. So it's been difficult for everybody. I understand it's been difficult for many in the public. And that's apparent from a lot of the comments that we received today. But I just think the language in the resolution seems to widen the gap between neighbors at a time when we should be finding common ground to move forward and deal with the many important issues facing our communities now as we move out of the pandemic. Furthermore, I'm struggling to understand the rationale for the resolution, given that it's directive towards the health department, or I don't think are legally binding. And the attorney, Mr. Cross, will address that, I believe. And we're only creating confusion for the public. I can only conclude that this is more of a statement, a political statement. And I get that. I may not agree with you, but I respect the opinions of others and try to understand where they're coming from. Respectfully, I believe that the effort placed in this resolution is misplaced. Local health departments are part of a national and statewide public health system that are predicated on federal and state laws. And that, is the way it is right now. And if you want to change that, I just think there's a better avenue to do that through the legislative process at the state level. It's not going to change anything by passing this resolution. We still have to follow state law. And that is the issue that I have with it. Otherwise, I feel like this debate, regarding how this should be done is just not productive as far as the amount of time that we're spending on it, where that time could be spent in other areas. And I would welcome, I agree with Commissioner Levanway that there's no harm in listening to getting a written opinion from the attorney and really taking this slow, and really understanding, what we're getting ourselves into. And perhaps there could be something else that was developed that didn't have directives that we know that may not be legally binding, because I don't feel that is necessary or productive and doesn't really achieve anything. So I just wanted, I just felt obligated that I needed to state that. But, I respect the board's opinion and their vote, and we'll just move on from there. But, I just wanted to also say that, I think forging ahead, obviously a lot of you are new to this, and, I appreciate the opportunity to educate and inform you about the health department and all the great work that we do. So.
Thank you, Dan. I have a few questions, and I guess, Mr. Ginup, I'm going to direct them to you since you brought the resolution forward. Who drafted this resolution, or where did it come from?
An attorney friend of mine drafted this.
Okay. So it was reviewed by an attorney? Not the health department's attorney, although I know he's reviewed it as well, but this was drafted by an attorney that you're familiar with?
Yes.
Okay. So then my next question I frankly share some of the same concern that Commissioner Levanway has, and that Dan has just restated, that whether or not I get the motivation behind this. I hesitate to bring this up, but back in September of 2020, I was one of the 4 commissioners that signed a letter asking for the mask mandate to be rescinded by our health officer at that time. And since then, I've learned a lot about the Michigan Public Health Code. I don't believe that the language that is in this resolution, and I'm not saying that I don't support the intent behind this resolution, but I don't believe the language that is in here is supported by the Michigan Public Health Code. For example, the second therefore, line 3, the health department shall not impose, permit, or enforce COVID vaccine mandates. The term permit, I think, can be interchanged with the word allow. And I don't think we should be in the business of determining whether or not COVID vaccines would be allowed. That would be contradictory to, like Mr. Turnbull said, whether or not your own private physician, if you chose to take the vaccine, whether or not they'd be allowed to give you that vaccine. I'm curious also why the 28 calendar day limit on emergency measures.
So that is the legislation.
That's the proposed legislation, or that's the
law.
That's the law now under
State law.
Okay. Which takes me back to the point that was brought up by one of our public speakers. I believe it was Mr. Corral. This has already been determined by the Michigan State Supreme Court. Our governor absolutely overreached in her orders. And that was determined already by court. So I'm not sure I can support that. I have a question how we, looking at the Michigan Public Health Code, specifically 333.2453. If you have your copy with you. .2453 says, if a local health officer determines that control of an epidemic is necessary to protect the public health, the local health officer may issue an emergency order to prohibit the gathering of people for any purpose and may establish procedures to be followed by persons, including a local government entity, during the epidemic to ensure continuation of essential public health services and enforcement of health laws. Emergency procedures shall not be limited to this code. So, as Mr. Chamberlain pointed out, if we were to pass this resolution, that puts Dan in a no-win situation as our public health officer. The Michigan Public Health Code gives him certain authorities that we cannot supersede. We cannot override. But we'd pass a measure here that puts Dan in a contradictory position.
Mr. Chairman, could I respond to that just briefly?
Hold that thought.
Okay.
I don't think this is the forum. I think Michigan legislature holds the authority over the Michigan Public Health Code, and we do not. And if we want to see change brought about, I believe that has to happen from folks on a higher pay grade than us. Again, I understand the motivation behind this resolution. And I'm not saying that I disagree with its intent. But I want to make sure that any resolutions we pass are in compliance with state law. And if we need to make changes to the Michigan Public Health Code, then my opinion is that it is not this board's place to do so, but it is that's vested with the Michigan legislature. Mr. Rubin.
Yeah, just on your thing about the power of the health officer, although that's true. This resolution doesn't, excuse me. This resolution doesn't preclude that. It just says after 28 days, they have to bring it before this board. And a 3/4 majority has to allow that to continue on. Which, if it's a true emergency, I have no doubt that it would be 100% vote from this board. The 28 days is somewhat concerning to me. I view it as way too long. If people are required to remain home, my cows aren't going to get milked tomorrow morning. And when cows go 48 hours after not being milked, they start to die. And the percentage of death just goes up the longer the hours are, because it's kind of a nature thing that we have problems with mastitis and other things if cows don't get milked on time. So the 28 days, I would think 48 hours would be enough time to convene this board and say if there's a true emergency and if people need to remain home. But again, that is a state law that without legislative approval, nothing beyond 28 days may be enforced.
Okay.
Mr. Chairman.
Mr. Mason.
Also, an attorney from Otsego County also reviewed this and he liked it. He also discussed the 28 days. But he liked this resolution as a whole and pretty thorough. Retired attorney.
Okay.
County.
Thank you. Would the board like to hear from our attorney on his opinion? Mr. Mapes, I would as well. He sat here all morning. It's almost lunchtime. It's after lunchtime. Matt, go ahead.
All right, I'm going to give you a big picture again. If you guys want a written opinion letter after this.
Can you make sure your mic is on, please, Matt?
Something I'm supposed to flip here.
It's on. You just got to put your mouth closer.
There you go. You guys hear me now?
Yes.
Okay. So I'm going to start big picture. If you want me to get into the weeds in an opinion letter, I'm happy to do that. But you got to think about how this is set up. The power that you all have as a board, the power that Dan has as the health officer, it's all derived from the public health code. Okay. It says what you can do. It says what you can't do. Okay. Now, when we're talking about your oversight of the day-to-day actions of the medical director of the department, you have approval over regulations. Now, regulations are distinct from emergency orders, and that was an open question until December of last year. The Court of Appeals in a published opinion said, emergency orders are not regulations. The Board of Health has no say over them. You can't approve them. You can't disapprove them. Okay. So that's really the overarching scheme that we're working with. So in some, I mean, these provisions of the resolution, the therefore paragraphs that are trying to place, time limits on the emergency orders. I've heard multiple people today cite to 28 days and to the statute that it comes from. It's a completely different statute. The Public Health Code is one statutory scheme. What they're talking about is the Emergency Management Act. That's MCL 30.403. That talks about the governor's power to declare a disaster. It's a completely different statutory scheme. Okay, so that doesn't have any support in statute. There's no state law that says that on this local health department level, you all can put that kind of cap on what the health officer can do. So I know it cites to the Constitution and the preamble paragraphs, but it does so in generalities. I mean, if someone had challenged this provision of the Public Health Code, the provision that being section 2453 that gives the health officer power to put emergency orders in place. If someone had challenged that on the grounds of constitutionality and said it deprives people of due process or equal protection, that's one thing. Okay, then we can cite to the Constitution and say, okay, well, that law has been invalidated. It's not on the books anymore. Now we can put that limit in place. But current status quo is you can't. I mean, it's not. And I would, if you want to look for it yourself, you could look at the case of Flynn versus Ottawa County Department of Public Health. It was from December 15 of 2022 as a published Court of Appeals opinion. And again, that's where they said that there is a distinction. There is an oversight role for you all as the board when it comes to regulations. There is not such an oversight role when it comes to emergency orders. So that's the long and short of it for me. I mean, if this is passed, I mean, I know we have that same provision that we include in all ordinances, all legislation. If there are parts of it that are invalidated, the remaining parts stay in place. I just don't know what is going to be left after those provisions are struck. We're basically left with some of the general paragraphs, but I mean, any limitation you're trying to put on the health officer is not something that is consistent with the Public Health Code.
Thank you, Matt. Any further discussion from the board on the proposed resolution?
So just for clarification, are you saying that this resolution would be illegal?
I'm saying almost all of it would be invalidated if it was subject to a legal challenge. I mean, I think you might be left with some of the general paragraphs that talk about, medical professionals within the jurisdiction. You can feel free to discuss. I mean, these general things that you're not trying to impose limits on what the health officer can do. Those will probably still be there, but I mean, I think those things are already things people can do. They can already consult with their physician. They can, so I don't know what would be left, but yeah, I think the operative provisions that place limits on how long an emergency order can be in place, or the what is essentially a veto power of the Board of Health. They have to come back and get a three-fourths majority to keep it in place. Those will be gone. Is my opinion. It's not something that has been squarely dealt with by an appellate court yet, but that's what the Public Health Code says. I think it's pretty likely that most of this would be invalidated.
Any further discussion or questions? Mr. Meyerson, Dr. Meyerson, rather, sorry.
I guess I just had to chime in a little bit. I would just wanted to echo what Dan says. I guess I'm not quite sure why, some of the commissioners think that there's a need at this time to do this, that there's some emergent reason why you need to do this right now, and then also what you would expect would come from it. And I think, as you said, Scott, and as the attorney said, I think the resolution is clearly has symbolism to it. So it has a symbolic benefit, perhaps, for the people that have been calling you or talking to you, Jairus or Rich. But I completely respect the opinions, and listening to some of the commissioners that they don't like what they perceive as a lack of checks and balances. And I completely respect that opinion. I understand that. I get that you don't like how the current law is written, and that you should have oversight, and that an individual like a health officer shouldn't have these powers in emergency situations, that there should be better oversight. I respect that. But I think, as you've heard, it's the law right now is the law, and we have to do our job within the confines of the law. And so when you're looking at this resolution, which is clearly divisive, it's clear it has no legal enforcement. It doesn't change anything we'll do in the agency as far as our policies or our procedures. It really has no constructive purpose. And what I mean by that is we're trying to move forward here. The pandemic's over. We're trying to move forward and do the things that we are supposed to do. And this resolution is a political opinion, and I think it's an important opinion, and I respect that opinion. This just isn't the place for it. The resolution, and I think your constituents who want you to vote for this need to know that you can pass the resolution today, but it has basically no legal enforcement whatsoever. It's It's symbolism, it's political theater, it's nothing more. Thank you.
Any further discussion among the board? Okay, let's call the question. A yes vote is to pass the resolution, a no vote is to deny the resolution. Mel, can we have a roll call vote, please?
Commissioner Henkins,
No.
Commissioner Levanway. No. Commissioner Chamberlain,
No.
Commissioner Mapes,
No.
Commissioner Mason,
Yes.
Commissioner Rubing,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Ginup,
Yes.
motion
Fails.
failed.
Is that a 4-4?
Yes.
Okay, the motion has failed. Moving on. Staff reports, Mr. Thorell.
Yes, we do have a presentation that Jeremy was going to do.
Ladies and gentlemen, I'm going to ask you to be quiet, please. We are still continuing the meeting.
We do have a presentation that Jeremy Fruc was prepared to do on PFAS in Pellston. And I can either talk about, if you need time to get ready, Jeremy, I can. Okay, all right. I'll just go into my report. And this is really talking about accreditation. I've talked about this before with this, but since we have a lot of new board members, I thought it would be a good time to bring it back up. Since we are about a year out, close to a year out from our next round of accreditation. Which basically what that means is that the state comes in and they review all of our programs based on a set of standards. And those standards, basically are set up so that we are accountable. It provides a mechanism for accountability. It assures a process by which the state can ensure a local level capacity to address core functions. We can assure a uniform set of standards and define public health and assist in continuous quality improvement. One thing that I will be, and I'm not going to go into great detail since, this is, I've got a long report here, but I just want to highlight on what accreditation covers. And basically it covers local health department powers and duties, which is more or less taken right from the public health code, what we're allowed to do, what we're supposed to do, those type of things. Food service program, onsite wastewater treatment, general communicable disease control, immunizations program, HIV, STD, family planning program, and children's special health care. And then those are part of the official accreditation program. And then we have other programs that are also evaluated on even a more frequent basis because of regular accreditation is about every 3 years. And because of the pandemic, it was put on hold. So normally we would have been going through this process basically last year, I think at this time. So it was basically put on hold for about 2 years. But some of our other programs that are looked at are the private and type 3 water supply program, non-community water supply program, the WIC program, things of that nature. And those reviews can even be more intense because they're on a more frequent basis, 1 or 2 years versus 3. So as I said, we're going to be accredited. We'll have the reviews and visits coming up in April 2024. And over this next year, there's a lot of things that we need to do to prepare. One of which is the local health department plan of organization. And I need to bring that. I will be bringing that to the board. I have to bring it at least 60 days prior to their visit for board approval. So you'll be hearing more from me about this. And this really covers, I put a link in there about the guidance document so you could go in there and look at it yourselves. But it really covers the legal responsibility and authority of the health department, our organization, things like our mission, vision and values, strategic planning, collaborations, service delivery, just a whole broad spectrum of things. So we will be, I will be bringing those things to you, bringing them forward to you as we're working on them throughout the year. And I just wanted to make you aware of that. So just some highlights I wanted to talk about. Early in March, Dr. Myers and I gave a presentation at the Lunch and Lecture Series at North Central Michigan College. It was basically just like an overview of health department services for the public, what we do, and gave a snapshot of demographic conditions, which drive our health policy and decision-making. The lecture was very well attended, and I was, really happy to see that kind of a crowd come out and hear us talk, because we're not really that interesting as far as speakers go, but, we had good content, so that always helps. And then Holly Campbell, Deputy Health Officer, sitting next to me, and I recorded 3 short segments with 9 and 10 News in their studio in Cadillac. Their segment is called Wellness Wednesday, and we talked about the dental programs, food safety programs, and immunizations. And we're planning on doing some more in the future. And this is just kind of our overall plan to just let people know what we do, how we do it, and just efforts to be transparent and just build trust back with the public. There's, obviously, communication is a big part of what we want to improve, and transparency. We can always improve that too. So that's part of that whole effort. And then letters detailing specific environmental health records. At the last Board of Health meeting, we were talking about that a little bit, and I sent those out to everybody, asking that they talk to their county administrator about it. And actually, I heard back from Dave Boyer. So thank you, Commissioner Mapes and Ginup, for talking to him. And he's really excited about jumping on board with this and maybe wanting to pilot this. So hopefully, and I talked to Jeremy at Antrim County too, and I'm planning on talking to your other county administrators to get this going. And I think Emmett County is really wanting to move forward and pilot this. And really, I think we can do it on a county by county basis, realizing that some counties are not ready to invest in this quite yet. And that's fine. And I think, just getting started is a step in the right direction as far as getting records online. It's going to benefit the public. It's going to benefit the staff. It's just a good thing to do. It's being done, all over the state. And just having people being able to access their records at their fingertips is really going to be a step in the right direction. So, and also I just wanted to follow up. Last thing is an update that I reached out to Laura Genovich at Foster Swift Collins and Smith regarding our 2 ongoing lawsuits against the health department. Let Them Breathe versus the Health Department of Northwest Michigan and Gaylord Community Schools, and concerned parents of Emmett County versus the Health Department of Northwest Michigan. These are both at the Michigan Court of Appeals. Briefs have been submitted, and we're currently awaiting oral argument dates for both cases. So I know last time there was some discussion about that, and I just wanted to make sure the board was aware of what was going on. So that's where we're at. And I will make sure I inform the board once I know more information as well.
So, well, does anybody have any questions for Dan?
I do.
Please.
Under the plan of organization, have
Yes.
we done that before? Is this something new?
No, this has been done since I think the first round of accreditation was in the late 90s.
So you're just going to update it?
It needs to be updated.
Okay.
Yes. Yep.
Thank you.
So yes, I talked to Dave Boyer about that. And yes, we should be digitizing. This is 2023. Why are we still doing paper copies and taking so long to look up about septic systems and stuff like that? So I appreciate you working with Dave, and I've kind of encouraged the other counties to step on board with us on this. So it would make it tons better, easier for the public to access the documents and stuff like that. So.
Absolutely. And, just so everybody knows too, I've said this before, but, like I said, we have a lot of new board members. I did this when I worked for Grand Traverse County. I have firsthand experience with it, and I can tell you it is a game changer. It makes things so much more efficient for the staff and for the public. So, and faster. And right now, basically just working on getting updated numbers since the last time we put this proposal forward. It was about 1.5 years ago. So expecting some numbers to be a little bit bigger, but hopefully not too much bigger.
Anybody else have any questions for Dan? Go ahead, Jairus.
Yeah, on that same note, it's primarily well and septic records that we would be digitizing, is that
It would be well and septic records and site evaluations.
site evaluation?
Right. So if somebody like a vacant land, piece of vacant land, they had us look at.
And how far
Or-
back do we have to go?
We are expecting to digitize all of our records.
Okay.
So as far back as they do go.
Uh-huh.
Right now, the way that the records are organized are by, only section and township, which is pretty broad, right? So you have some pretty big, some sections that are pretty populated and have a lot of houses in them. So those files are huge and it's just, the efficiency is just terrible as far as trying to locate records and whatnot. So part of this project would be getting it down so they would be searchable by address and tax ID number, as well as by section and township. So
Well, you sent me the quote and it's expensive, but I was expecting it to be more expensive, to be honest. So
Yeah.
that was somewhat encouraging. We're looking at digitizing other records in Antrim County. I mean, don't know how far the budget's gonna go, but
Well, Dan can work on that, make that more closer to what you were expecting.
yeah.
well, the quote,
Well, hopefully not.
the quote is what, a year and a half old, and
It's a year and a half old. It was done in, I think that letter was sent out in August of 21. So, yeah, I expect. I did, it was a few months ago, I had the scanning company reached out and I asked them, how good the pricing was for, like, do they need to redo it? And they said it was good through May of this year. So that's next month. I don't expect that it's going to be a great deal more, but I expect it to be a little bit more. So.
and they can do one county at a time, or what's their?
We can, yeah, so I had a conversation with the company that we selected, as far as the document management company, which is Laserfish, which I think Antrim County has some dealings with them as far as some of their other records, and I know Emmett County does, as well. They can, I asked them, the original quote kind of based it on all 4 counties. So I asked them if we could get it requoted if, one county at a time, and starting with Emmett County, that quote is supposed to be sent, today or tomorrow. And then, we're going to go from there, and I'm going to talk to Dave and see what we can work out as far as, getting this off the ground. I think the biggest expense, 2 of the biggest expenses, it's not necessarily the document imaging software. It's the scanning of the records, all the archived records, and then redacting those records, because you have people's personal information on them, phone numbers, things like that. So you have to basically hire people to go through them and black out those areas of personal information. We had a legal opinion on that, and that was what our attorney told us that, we had to do, because we didn't know if we had to actually redact or not redact. And I guess, I haven't got a new opinion. But we have a different attorney now, because it's been all over the place with other people that I've talked to. When I was in Grand Traverse County, the attorney there said, no, you don't have to redact them. So it's, that's quite an expense. So I do want to track that down again and maybe revisit that, ask that question again, now that it's been a few years and,
Yeah. My second question was on our leases. I mean, we saw a summary of them in the audit,
Mhm.
and we own different buildings in different places. Have you, I know you haven't been here a long time, but have you gone through and kind of categorized where we're at and how many years we have on each one and what future needs might be on that? Or what's your overall take?
We do have them organized. I was just actually talking about wanting to do a spreadsheet, so it was all in one place. I mean, we do have all the leases in one place, but you have to pull them out and look at them to see what the dates are and all that. So that's something that we're working on. So it's more readable, when you just want to pull it up and see it. But that's something that we certainly are working on and can do.
Yeah, I mean, we talked about it in the bills. We saw some pretty big dollar amounts, but we found out it was for more than one building. So,
Right.
and it'd just be, it'd be good to have a overall view and where we're at and.
Yep.
And where some of these buildings revert back to do they all revert back to the county over time or? I don't know how they all work.
That's the typical arrangement, is that they revert back to the county because the county gave the land. And then after that 20-year period, it would revert back to the county and then the health department is leasing from the county.
Right.
That's the typical arrangement.
Any other questions for Mr. Thorell? I have one briefly, but does anybody else have any questions for Dan? Hearing none. Item number 4, your update from Ms. Janovich. When does this board get to make a determination about how far these lawsuits go? I don't want the attorneys deciding how many billable hours they're gonna rack up. And since the mask mandate is now done, I understand these lawsuits are still going on. And I don't mean to step on anybody's toes, but here's who wins in lawsuits that go to the Michigan Court of Appeals, the attorneys who are arguing them. That's who wins.
Right.
And we're paying for our attorneys on what should be moot cases now.
I agree.
So I guess I'd like to see. I don't know how we proceed from here. I don't know what the next best step is. And I don't know, Jarrison and I spoke briefly on the phone one day about this. You know, what's the best desired outcome for either side?
Well, I think, you know, now that basically the majority of the work has been done, the briefs have been filed. So we're at this point now where oral arguments are going to happen. That's going to be like, you know, one day, right? Or a few hours out of one day. So I think we're at a point where it would be wise to let that process play out. Hopefully that's the end of it. And we're done. But I don't know. I don't know the answer to that question as far as like, if, you know, we would be happy if obviously if the lawsuits are thrown out, it's moot, right? The mask mandates are not in place. It's done. But I don't know what recourse the plaintiff has. You know, if the Michigan Court of Appeals rules in our favor, do they have an avenue? You know, I guess they could ask the Supreme Court to hear it, but I don't know if they will or they won't or what that process looks like. So I would just say it probably would be a good idea, maybe, you know, once this current situation plays out, that we get a clear path from our attorney, if, you know, that is the case, if it looks like they're continuing to challenge us on this and what we need to do. I don't know what it means if we just decide to like, hey, we're done, we're stopping. What does that mean? I don't know.
So once we have a determination from the Michigan Court of Appeals, I think this board needs to have a discussion prior to continuing our defense. You have 6 new members on this board from when these lawsuits were initiated. And I think we need to have a board discussion with our attorney before we would continue anything past the Michigan Court of Appeals oral arguments. That's my own opinion. Board, you can disagree with me, but
I think that's a great idea. Because
Mr.
I mean,
Rubin.
the costs of these are just getting, it's, you know, if you look at it over time, you know, it's been a few years, but it's a lot of money.
Right.
Well, I would just echo Mr. Hankins, but I would like to know, what do they want? I mean, most of the lawsuits that were involved in Antrim County, they sit us down, you go into closed session, you have a meeting. What do they want? What do they want to settle this? Because I want to be done tomorrow. I'm, like you said, attorneys are the winners. So do they want $1 million? I don't think so, but how do you know until you sit down and ask? That's obviously not acceptable, but until we sit down and have a meeting, How do we know what do they want? I mean, could we end this tomorrow? If we could, we'd all be better off, you know? So I think we're on the same page. But I would like to have that talk sooner than later, to be honest with you, and find out. Does Swift and Collins, do they know what they want to settle this, to be done? I mean,
Yeah, I don't,
we shouldn't be spending our legal fees for a state health code. I mean, that's the state's job to defend, in my opinion, but
well, my understanding is that this, the lawsuits, they're not suing for damages like money, right? So I think what my assessment is, and what the plaintiffs are trying to do is get a declaratory judgment against the public health code, right? That was used to invoke the mask mandate. Okay, I think that's really what's going on here. Like I said, I think we're at a point where we're at the very tail end of when this is going to play out in the Court of Appeals. And I think we'll know a lot more once that is done. And once we have that information, I think we need to take a really fresh look at it to see, where do we go from here? If it's done, hopefully it's done, right? I mean, that's the way it was in the past. And then I would get a call and say, oh, guess what? They've refiled, this or that, and we're going to the next level. I don't know if that's, once you get to this point, is that going to continue on? The only next level is the Supreme Court, and I don't even know if they would hear it, but I think I don't know, like, even if that happens, like, then do you have to file another, brief or something, even if it's contemplated? I don't know. So, I mean, there's a lot of unknown questions that I'm with you. I think we need to take a fresh look at it. And
so I would agree with Jairus that if the Michigan Public Health Code is what we're trying to define, then let the state AG's office handle that argument instead of us paying for it.
I have made that argument and it has fallen on deaf ears.
Okay.
That's
with Ms. Janovich, it's fallen on deaf ears?
No, with the state, like, I think in this case, health departments are kind of left out hanging in the wind, as far as defending these legal actions these actions that are, some would argue, you can argue the merits, but the public health code is a shall, you shall do this, you shall do that. And so if someone is challenging that, you're on your own as far as defending yourself, where, you really kind of, I don't know, it doesn't seem right, as far as that goes. And maybe the Attorney General's office should play more of a role in that, if that's the way it's going to be.
but if I'm the Attorney General and the Health Department of Northwest Michigan is picking up the bill, why would I get involved? So when we say, no, we're not. Oh, well, if it's either that or no, then all of a sudden, that's where my mind goes,
Right.
Mr. Mapes, go ahead.
Question, if the litigation is concerning the public health code regarding masks and we pull out, what happens? Or we call timeout, this is not going anywhere, what happens?
Well, that's a good question. I don't know at this point. That's why I said, we're at a point now where we're at the very tail end of everything that's been going on with this. And I think once that happens, we need to really determine, where we go next.
But, that's not our health code. That's the state health code, correct?
Well, it was, so the mandates that that the previous health officer did back in, late August of 2021 were based on the public health code 2453, which we've heard about and talked about earlier in the meeting, which gives the health officer the power or the ability to pass epidemic orders. And that's what is being challenged.
So my question is, were those that person's own orders, or did they come down from the state?
Well, it's the health officer's orders that are permitted by the health code, by the public health code. So it was the health officer's action.
I guess my whole point is if it's a health code, that's directed by as part of the state health code that we're mandated to follow, which if I'm hearing correctly, why are we being sued and not the state?
Well,
Yeah. So there's more to it.
we're being sued and not the state because the governor said, let the school districts decide. And our former public health officer said, no, I'm going to decide. And she put out an emergency order. That's why we're being sued.
Okay, so there's an option there that she could have decided not to pursue that and we wouldn't be facing this lawsuit.
Correct.
Okay. Thank you.
Okay. We're pushing 4 hours. So Dan, you don't have anything else to add, right?
No.
Okay, thank you.
I don't, and we could, I'd hate to,
We can wait till.
we could do Jeremy's presentation next time.
I don't want to shortchange Jeremy, but
Yeah, it's
this,
fine.
this is, yeah. Jeremy, are you good for next month?
Yeah, you can do that.
Hey, give it up for Jeremy.
Hey. Well, I think Jeremy will be, he could skip a month for a board reports, right? So I mean, it's, yeah.
Okay.
He's happy about that.
You have written reports from several other directors in the health department. Does anybody have any questions for any of our directors? Mr. Rubin.
Yeah, we got the, trying to find it here. Holly had a report on the Citizens Advisory Committee. Could you give us a little bit of update on that?
Oh, sorry.
That's okay. Sure. We have formulated the committee and we will be convening this month in Charlevoix County to have our first meeting and to go over what the intent and the purpose of the committee is. And me and Janine Pung are going to be facilitating, giving them a general orientation to what the health department roles and responsibilities are, similar to what we did at our first orientation meeting. And this really all ties back into a project that we're working on in external perception and transparency. So you can really think of the Citizens Advisory Committee as a large focus group that we have at our fingertips. There's a diverse thought. There's people that maybe don't agree with a lot of the things we do, or people that do agree with the things we do. So there's a wide variety of participants and we're looking forward to what's coming out.
I guess my issue is that this was never brought before the Board of Health to approve. And we don't know how much money we're spending on it. We don't know how many hours of staff time are going to be spent on it. We don't know how many hours of citizen time are going to be spent on it. And if I look at the code here, I really don't know what authority they have.
They
I mean,
have any authority. It's not about authority. It's about us reconnecting with our community and the community partners and stakeholders from our 4 counties to have them involved in decisions and programming that the health department provides. And this was put in place before the motion was passed to have, everything brought to the program and evaluation committee.
what I would like is for all of this information to be brought before this board and to have us have an up or down vote on it.
Okay, but that wasn't, I can defer to Dan, but this was a grant through the Michigan Health Endowment Fund that was received.
And I may or may not have a problem with it, but I don't have the information. And I do know that there's only so many hours in a day for staff and for citizens. And when it comes to transparency and openness, we got a great group here today. We heard all sides of the issue.
Right.
And I think citizens did a great job expressing where they were.
They did, and
And
that's why we're trying to engage them to get them
They
to
have-
open up
they-
in other
They
issues.
have that opportunity twice every meeting, every month, and maybe more than that. I mean, my email box is open all the time. So I guess at this point, I have issues with it, but I don't have all the information either. So I would like it to be brought back before the board with all the information and to either approve or disapprove it.
I don't think that's what was voted on, but I'll let you talk.
Well, I'd just say, I mean, so the process of the policy that we're bringing forward today that kind of details new programs going to the Program and Evaluation Committee. This grant was applied for well before then, and it was accepted by the Michigan Health Endowment Fund. And really, you know, I guess I'm surprised that you have an issue with it, because it is engaging the citizens from all different walks of life to basically help us understand, you know, what their needs are and what the common ground is as far as what the health department should be doing. And we don't have to, these are not things that we have to act on. We just are getting information from people. And I would just say, you know, I mean, we would love to share more information with you about this whole process. I mean, it's in its infancy right now. We haven't even had the first meeting yet. And it's not going to take a ton of staff time, and that's been factored into the grant and everything else. And it's, you know, we're very conscious about the people's time that are participating too, to not exceed, I think it's 90 minutes, I think is like the max time that they're going to be meeting with us, and it's monthly, I believe. Right.
We would like their term to be a couple.
And how long is it gonna last?
Well, the grant goes through that end of the fiscal year.
Yeah, so through the end of this year. And really, it's just, I mean, it's an effort from our standpoint, just to get to know our citizens more and understand where they're coming from. Which I don't think is a bad thing. I think it's a good thing. I think, you know, anytime we could do that, you know, it's a good thing.
Mr. Mason.
Who specifically chose these people? Because you do have individuals in mind for this board. Who made this choice?
Well, first of all, it's not a board, it's an advisory committee. So lots of agencies have advisory committees that weigh in on programs, procedures, policies. These are simply your constituents that are volunteering their time to the health department for our betterment. So I do want to make that clear that this is not a board. They have no authority, and it's a volunteer basis. They're not being paid. And this is being provided through a grant through the Michigan Health Endowment Fund. So myself and Janine Pung, who is our communications coordinator, expert, we took recommendations from our entire health department team of who that they would think would be a great addition to this advisory committee. Janine has reached out to even people that have spoke public comment against the health department, that have raised concerns, so that we can do what I believe a lot of you have preached, is to be transparent, to bring issues before a small group before coming to the full board. This is not in any way an overstepping of your guys' authority. That is not what this is. I would think of it maybe as the PTO of the department.
Mr. May.
Just two quick questions. Are there any health department staff on this committee?
No, sir.
Other than probably you who would be,
Nope.
okay. Was there any new staff hired to
No.
oversee this committee?
Nope. Nope. This is all, we have 2 representatives from every county, which we're hoping for. We have retirees, we have young people, people from all walks of life, really.
would it be possible for, as representatives of Emmett County, find out who might be on that committee from our county?
I think we could disclose that.
Okay. And how much was the grant, by the way?
50,000.
50, okay.
Mhm. And this is just one small piece of that.
Thank you. Any further questions?
Yes, Mr. Chair.
Go ahead, sir.
Will minutes from your meeting be made available to the public following your guys' gathering?
I don't think so. I mean, I'm happy to share them with the commissioners if you
Would
would like,
minutes be
but
taken?
oh
even?
yeah, we can take minutes
Okay.
if that's something, some oversight you would like.
Any other questions? Not only for Holly, but any other questions on the written reports or to any of the other directors? Okay. Hearing none, we're down to committee reports. Personnel and Finance Committee.
I guess what we can say is that we went through the bills. We went page by page. It was Scott and Rich looked at the bills. And we're recommending that we approve of the bills. And if you want me to, do you want to move on with the motion?
Go ahead.
Okay. Because I went through the bills, I will make a motion. Based on the Finance Committee's meeting, the board approved the March 2023 bills in the amount of $545,029.14 and the March 2023 employee expenses of $17,372.95.
Second the motion. Is there any further discussion? Mr. Rubin.
Yeah, I saw in the bills that we lost $141,000 worth of checks in the mail. And I'm just wondering what happened there and why.
Well, that's a good question. It was they were lost at the post office. So we had to reissue those checks.
Literally, the checks were in the mail.
The
and
checks
then they
were-
weren't.
Right. Yeah. So that's very frustrating from our standpoint.
So our finance staff, we didn't lose that number. We didn't lose that amount of money. We lost those checks in the US Postal Service. Those checks were stopped payment and then reissued. Any further discussion? Hearing none, can we have a roll call, please?
Commissioner Turnbull,
Yes.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Rubing,
Yes.
Commissioner Ginup,
Yes.
Commissioner Mason,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hankins.
Yes.
Motion carried.
Where'd my agenda go? Okay, Personnel and Evaluation Committee. Or Program and Evaluation Committee, my bad.
You're really trying to confuse us.
Well, I refuse to get bifocals, so it looked like personnel at first.
We did have a meeting and Dan has something in your packet about what will be looked at with grants going forward. I think we got a great start. I don't know if any of the other commissioners that are on want to say anything about it.
I think we're working on updating the bylaws as well. too,
Yeah.
aren't we?
Yeah.
So that's still in the works.
I do. I don't know where it's at here, but it says that it would give the committee authority to approve of grants. And the committee is only 4 people, which is half, which isn't a quorum.
Yeah, I saw that. And I think there was some discussion about that and that didn't at the Program and Evaluation Committee level. And really, I think it was implied that full approval would happen at the Board of Health. I think really what this is, and probably some wording should change in number 3. Where the health officer will request Program and Evaluation Committee recommendation for approval for grant submission. And then, obviously the board has the full authority on that. And that would come to the board at the next meeting, if that makes sense. And I can just put that language in there and share that with everybody. I can put it, like, highlight it in red, and email it out, or however you want to do that, bold font. Whatever works for everybody, and just tweak that a little bit. If that works.
Well, I think that the way it's written, it says that the chair of the grant committee would be able to make a decision and then it would come to the full board. And I don't think that's wise.
Well, I think the reasoning behind it was we were talking about timing
Right.
and trying to, pulling the committee together, deciding whether or not we were going to go forward with the grant.
Right.
Right. And then the committee would, if they recommended, yes, okay, go forward.
I think that at the last meeting, some discussion was talked about if it was an ongoing grant, to just inform the committee. So they were aware of it, which would probably be your state grants.
Well, this really, I believe, what we landed on is that this is for new.
Only new.
grants. Right.
It doesn't,
Yeah, it does. It says that, it says it somewhere.
if there's a word
Okay,
to it.
this, under policy, the last sentence, the policy only applies to value added grants, not grants that are automatically awarded to the Health Department of Northwest Michigan on a yearly basis for core programs.
But it doesn't say new. It just
It-
says core.
Number 3, if the grant would result in a new program. And the rest of it, like 1, 2, we plan on, and this is essentially, I was capturing really what we already do as far as when we're looking at possible grants, the process that we
Right.
would go through. And number 3 would be if the grant would result in a new program, and that's when it would kick in go into the program and evaluation committee.
Right,
So-
but okay, so it says here, if the grant submission timeline does not allow for program and evaluation committee approval, the health officer informs the committee chairperson who can give verbal approval to proceed with the application. So what if that person says no?
Right.
The answer is no.
Well,
Well, I think,
but that's giving the authority to one person on a whole board.
Right, right. And I think what we talked about, which maybe it's not reflected in here accurately, is, if the answer is no, and we want to talk about it at the full board, then we can still
Bring it to the full
bring
board.
it to the full board.
Okay.
I mean, I think that's appropriate.
It just doesn't say that.
It just doesn't say that.
We need to change that.
Right.
The whole purpose of the whole purpose of that conversation in that committee was, to take some of the pressure off.
Right.
We're not trying to micromanage, we're just trying to oversee.
Right. Right. No, I
So-
understand that. And I didn't, as far as that goes I think it was more thinking about timing than
Right.
Yeah.
than the
Yeah,
other
but
stuff.
It
but-
doesn't say that, so we
Well,
need to add
yeah.
that in.
Yes, I agree. I think it would probably be more clear to add that.
There was a lot lost in the lack of wording in this, but that was the whole gist of it.
Right. And this is a draft. This is not the final, the final. Because exactly what we're talking about now, just wanted to get everybody's input and proceed from there.
Anything further? For program and evaluation. All right, hearing none. We will move to public comment again. Ladies and gentlemen, the same rules apply. You will have 3 minutes. We'll ask you to step to the podium, state your name, the county you live in, and then your 3 minutes will start. Mr. Chamberlain will advise you when you have 30 seconds left and when your 3 minutes are up. So would anyone like to address the board? Yes, ma'am.
So I heard a lot of symbolism talk and this resolution would be symbolism, but really there was some symbolism that happened not too long ago with the expansion resolution. Okay, that symbolism took off like wildfire. Okay, that resolution is helping us at the state level combat the PFAS situation and the expansion of Camp Grayling. So to say that a symbolic resolution, as you stated, this is a state level problem, legislation has to be changed. I do believe that a resolution would help us at that state level to relieve that. That's all I have on that. I do want to thank you for the grant and evaluation committee, or the programs and evaluation committee. That was a good step in the right direction as to curb some of this. Like I said, some people think there's a magic fairy in the trees dropping money, but that's our money. And a lot of times it comes with detrimental strings attached. I think in the last board meeting, there was somebody that stated that, we got $100,000. Now we just got to buy pot boxes for all the potheads. Come on. We got to really look at some of this stuff. We don't have to take all the taxpayers' money if we don't want it. We don't have to take it. It can go to the other county. Let them bear witness to that. The other thing is on the advisory committee. Since I've been coming to these meetings and you guys have seen me, well, actually before you were even here, I was here. And I made some friends here. I see some like-minded people and we've, developed a relationship at this meeting. I know I wasn't asked to be on that citizens committee, and I'm a well-informed person on what's going on with the Board of Health. I'm not sure if any of my other people that I've met here at the Board of Health meeting were asked to be on that Citizens Advisory Committee. So I do like the fact that you are going to get the names of those people. I would like to, I think it's a great idea to have a citizens evaluation team, or whatever you want to call it, an advisory committee. I just am wary at who chooses that advisory committee and what the qualifications are of that choice. Thank you. Oh, Marcy Beauchesne, Otsego County.
Gotcha. Thank you, Marcy. Would anyone else like to address the Board of Health? Yes, sir.
Comment. I'm Chip Hansen. I live down in East Jordan in Charlevoix County. I'm the president of the Charlevoix County Community Foundation for the next 23 days. And then I skate into retirement and leave it in Sarah Ward's able hands. But my question is really maybe for Dan. The Community Foundation's delivered about $180,000 in grants to the Health Department of Northwest Michigan over the past 4 years. We've provided funding to help women who can't afford cervical and breast cancer screenings to get those. We provided funding for kids and senior citizens to access toothpaste and toothbrushes and dental health. We helped reinstate the school nurse program during the pandemic. Pretty important time, we thought, to have nurses in our schools. And those grants are generally processed in a couple of days. Delivered through our Urgent Needs Fund. We try to be as responsive as possible to the needs in our community to help people who are less able to help themselves. And I wonder if we will be as flexible and as nimble with a local funder like the Charlevoix County Community Foundation moving forward with this grant oversight committee, because it occurs to me that your team, and trust me, we have made those investments because we have great faith in the Health Department of Northwest Michigan as a strategic partner in the public health field. We have great faith in Dan, great faith in Josh, great faith in the team across the board here to help those people who can't help themselves. And I'm curious if we're going to be as flexible and nimble moving forward and able to do those things, given the structure that you're considering for grants. That's my question. You can answer it later, but I do have a comment if I've got a couple minutes left. Maybe I don't. I've seen and heard a lot here today. But I've been concerned mostly about what I haven't seen and what I haven't heard. You all have nameplates in front of you. I've had the privilege of serving as a school leader for 27 years, 13 years running the Charlevoix County Community Foundation. I've had experience working with high-performing organizations, with high-performing boards. And on the back of our nameplates, at every one of those
30
every one of
seconds.
those meetings. Thank you. Our mission statement is written there. Here's yours. To serve our entire community and to achieve health equity by promoting well-being, preventing disease, and so on. I think it would be important moving forward together for you to remember what that mission is, because you're here for everybody. You're here for the tall ones, the short ones, the firm and the infirm, the capable and the less capable.
1 minute.
They all
Time up.
need
3 minutes.
you. Thank you so much.
Thank you.
Hi, I'm Mark Rybicki from Harbor Springs. This whole thing kind of just really disturbs me. And the reason it does is because our whole country is based upon the premise of personal liberty and personal responsibility. And we've taken this personal responsibility and we've shoved it to the government. And now it's no longer personal responsibility, but it's government responsibility. This really bothers me that we have this whole health thing. And when I was growing up, you were responsible for your own health, not somebody else. You were responsible for getting to the doctor, for checking things out. I don't understand where all this all of a sudden comes from. And it's all based upon this thing called grants, which also has strings attached. And there isn't a grant that doesn't have a string attached in some way or some shape or form that gives somebody control over you or the process or the county. And I'm really disturbed that we even have a board of health or that we even have a health organization. Because like I said, it's not government's responsibility, it's yours. In some way along the way, we've lost that. That's all I have to say.
Yes, sir.
Larry Corral, Otsego County. The communication I brought you earlier, I think, implied that you should not take a position on mask mandates and all the issues that you've been discussing. That is not what I intended to bring you. What I intended to bring you was an urgency to make sure you publish something that you can stand behind and will serve you and your constituency, and will be something that you can defend, and it will not hamper you or embarrass you going forward. So I encourage you to consider that, but take your time. Thank you.
Thank you, sir. Would anyone else like to address the board? I have, that gentleman was started up first, Ms. Moore, so, okay.
Would just like to return briefly to a comment I made earlier that given the level of tension I've heard today, the level of differing sources of information, the levels of disagreement, the level of acrimony in some cases, I really think it would be helpful if you engaged in special sessions outside of this format, actually bring in a facilitator so you can have meaningful discussions, thoughtful discussions, arrive at some decisions where you don't have an actual decision that needs to be made. And I would recommend that that those meetings be facilitated, that you dispense with Robert Rules of Order for those meetings so that you can have a skilled facilitator leading the discussion. And I might recommend that a good credible source of those kind of facilitation skills would be Michigan State University Extension. They have people that are trained to lead these kind of community discussions, and just I think it would serve you well to improve the level of trust and understanding between commissioners, the public, and the Board of Health. Thank you.
Appreciate
And I
that,
forgot to
sir.
say, my name is Larry Dyer from Petoskey, Michigan, and Emmett County.
Thanks,
Thank you.
Larry. I would point out, Larry, that anytime 5 or more of us get together, it's a public meeting, so we are required by law to post it, and we function under Robert's rules. So thank you, though. Anyone else that would like to address the board? Yes, ma'am.
There. I'm Ellen Baird from Elk Rapids, and I just wanted to say this was very informative. I have not been to a meeting before, but I appreciated all the differing opinions. I know it's very
hard to, well, I want to say that for sometimes to get together, discuss and come to some type of agreement. But anyway, I just realized, I mean, it's a taskless, a job where you just have to work a lot and maybe don't get a lot of credit for it. Thank the Board of Health. And Juris, Jairus, I wanted to introduce myself. I am a constituent. I have several friends that were here from your district that obviously you might not have known our opinions, but I'll make sure that we do contact and let you know how some of your other constituents feel. And also, I did mention to Melanie, I tried to call you one time on your website. Your telephone number is for the court office. And so when I called and they said, no, Jairus doesn't have an office here. Well, then I looked and it's all the same telephone number for everybody. So you might want to change that. And she gave me your number, but I thought it was your personal number, I think. Anyway, I didn't use it because I didn't know if I was supposed to have that. If that's a change you want to make on your website, so your constituents can contact you, speak to you personally, or leave a voicemail, I would suggest that because the number that's on there now doesn't go anywhere. But anyway, thank you for all the work you do, and I appreciate it.
Thank you, ma'am. Would anyone else like to address the board? Ms. Moore, you stood up a minute ago. I'm sorry.
I too thank you very much, all of you, for your time and energy. And okay, so Mary Moore, Emmett County. Just a couple last things. I agree with whoever said that you should continue to think about this motion and that symbolism is just fine. There's nothing criminal about passing a resolution here. Your lawyer has advised you, and I heard him, that he thinks that if it was brought to court, parts of it would, a judge might rule that parts of it were null and void, but parts of it might survive. And he based that on a reading of the statute language, actually, which is all that the appellate court did, that the decision that he talked about that I have never seen. I'm a retired lawyer, by the way, and I was never licensed in Michigan. So I'm just giving you my retired point of view here. But I think a constitutional lawyer with a broader view would see the merit in what I have been telling you all this time, which is you have the judge in Otsego County who said in the context of the Iron Pig case, that decision of the Supreme Court back in 2020, October of 2020, which said the delegation of powers to the executive branch was illegal, that decision applies to the statute that your lawyer was talking about where he was parsing the language, and that the Supreme Court under that decision actually would potentially have to throw out that statute as unconstitutional under the Michigan Constitution based on a delegation of too much power. So my personal view of the legal landscape is broader and bigger than what this lawyer presented to you. And I recommend you go figure out if what I'm telling you has any credence to it. And again, I would go ahead and pass a symbolic resolution if I were in your shoes. Let me go to the lawsuits that are currently proceeding at the appellate court level. Those lawsuits are at cross purposes of the resolution that you considered. Those lawsuits, if you succeed with the lawyers that you're paying, will strengthen the dictatorial powers of the local health officer. Is that really what we want to be spending our tax money paying for? I just leave that question with you today. Finally, on the advisory committee, I also have a few questions about that committee. I agree with the question of who's picking them. And then I wonder if they're all volunteers, what the 50 grand grant is covering. I'm guessing it's that covers salaries of people employed by the health department, but that's the remaining question that I have about that committee. Thanks so much.
Thank you. Would anyone else like to address the Board of Health? I'll come back to you, sir. Okay.
Thank you. Yes, Brenda Colvita. Before I lose my train of thought, there's a lot of disappointment on my part today for the resolution that didn't pass. I'm hoping it'll come back and that eventually it will. Mostly because when all the stuff happened with with COVID. I didn't know this existed. I didn't know the Board of Health existed. I didn't know mostly what the health department did, except when I hear people have to go for infant, good, shots and dental, and yeah, that's great. And then all hell broke loose when the health officer did what she did. And so I need to remind some people here, I think some people are forgetting who they work for, actually. And all of us are citizens of the United States of America. And you take oaths of office, all of you. These are my commissioners, okay, from Emmett County, and I know you personally. And I think that's a wonderful thing. This is wonderful. This has happened to me. And there's a lot of people like me right now that are on fire. And what we are on fire about is things that happen to us that we feel we have no control over. And so this is what we do. We come to the meeting and we speak and we're heard, we're recorded, and we get involved. But all politics are local, all of them. For someone to say that what happened here is just politically motivated, absolutely disagree. I absolutely disagree. I had no politics at all involved when my son was being forced to do what he had to do, to play hockey with a mask on. He said, "Mom, I feel like I'm being waterboarded." It's just, the world just became an insane place that I didn't recognize at that point. So please keep this in mind as a governing body. You have control. So thank you. I appreciate everything you do. I know these meetings are long. I've been to probably 50, 60, 70 of these meetings, and I'm not going to stop coming. So thank you.
Thank you, ma'am.
Sir?
John Swartout, Emmett County. Before I can go on, as you'll discover, I'm not here to scold, to blame, to embarrass anybody here. Good public policy is damn hard work, and it takes frank discussion. My only goal is to help the Health Department of Northwest Michigan make good public policy decisions in the future. Now, where were we? Oh, the perils of professional blunders. Here's an article from the Detroit Free Press, February 4th, 1990. Doctor's problem, they don't know. They don't know. It's not their fault that they don't know. This article says, in June 1989, Dr. Robert Center, a prominent doctor of internal medicine from Richmond, Virginia, sat down at a congressional witness table and made a remarkable confession. When a patient comes to see him with a complaint, such as a sore throat or an aching back, Center told the members of Congress he lacks the tools he needs to make a sound decision, because medical science cannot tell him what kind of treatment works best for many common ailments. Center's testimony, delivered on behalf of the 65,000 members of the American College of Physicians, reflects a crisis of confidence that is just now being widely acknowledged in the medical profession. With surprising candor, doctors are admitting that they aren't sure what really helps their patients and what is useless or even harmful. So is it any wonder that we have iatrogenic harm? Iatrogenic, a Greek word, far and away the leading cause of accidental death in America is iatrogenic harm. Hippocrates, the father of medicine, who would be rolling over in his grave if he could see what's become of his offspring, was Greek, but I'll get to him later. Doctors' problem, they don't know. But like judges, cops, and seafarers, doctors still have to make decisions even when they have imperfect knowledge, when perfect knowledge is unavailable, which is most of the time. And predictably, the outcome is less than perfect some of the time. And then what? Speaking of mistakes lawyers and other professionals sometimes make, Attorney Lee Rosen wrote, "The cover-up is always worse than
30
the crime."
seconds.
I'll admit to being tempted to cover things up. I figure I can fix it. I can make it inconsequential. I can take an alternative approach, work around the problem, and turn on my spin master charm. It's that kind of thinking that turns a simple issue into a complicated mess, unquote. I'll see you next month.
Thank you, sir. Would anyone else like to address the Board of Health? Going once, going twice. Public comment is now closed. Commissioners' updates, Mr. Rubing.
Yeah, you don't always know what to mention here, but when I was born, Ronald Reagan was the president of the United States. And one of his famous quotes was that he said that 9 of the most dangerous words in the English language are, "I'm from the government and I'm here to help." I think sometimes, as I talked about last month, the first rule of economics is there is no such thing as a free lunch. And the second rule of economics is the fallacy of the broken window. So we can take a lot of money and we can see the good that it's doing, but what we can't see is where it would be going if we hadn't spent it where we spent it. And remembering that sometimes would create a less powerful government and one that would be more trusted by the citizens. Thank you.
Thank you, sir. Ms. LeVanway.
I have nothing.
Thank you. Mr. Ginnett.
I would like to thank everybody for all their comments on both sides. And I appreciate the common courtesy in most of it was directed at me. I understand that, but I appreciate where everybody's coming from. So thank you.
Thank you, sir. Mr. Mapes.
Again, just to thank you all for your public comments from both sides. I appreciate it. Thank you.
Thank you, Mr. Chamberlain.
Again, agree with these two. Thanks for coming out and giving your voice. I'd also like to encourage commissioners. I have 6 kids in public school systems. Encourage all of you to go to school, spend a day, see what the teachers do. You'd be pretty surprised what some of these grants do to help these kids, especially with what's going on in their lives right now.
All right. Thank you, sir. Mr. Mason.
Thank you, Mr. Chairman. I'd like to revert back to December because even now I'm getting emails. And it was brought up by Dan in the last meeting. It had to do with mindful schools, which we came together quite strongly concerned over grants in the schools. An article from the New American and UN pushing New Age spirituality and school children. Now, when I spoke to that, the back of my head, I was questioning the issue, a phrase or two here and there. An obscure UN agency has become a key vehicle for injecting New Age spiritualism into classrooms worldwide under the guise of social and emotional learning, SEL. Weaponized public schools for sinister purposes. An obscure United Nations Institute is quietly working to transform education worldwide to impose radical political and spiritual values and beliefs on children. It is all happening under the guise of social SEL, a scheme hatched at the New Age organization whose founder and namesake, I'm going to move down a little bit. There's 4 pages here, by the way, so I'm only going to give 3 or 4 paragraphs. The individuals involved also give the agenda away. Consider, for example, that the Institute was launched by a scandal-plagued UNESCO boss, Irina Bokova. Before joining UN, Bokova served as a high-ranking official in mass murdering communist regime in Bulgaria. New American exposed Bokova's history of extremism in a series of articles years ago when she was being groomed for even higher office. Goes into a little bit about her. Occult New Age spirituality is not Singh's only claim to fame. Interestingly, he served as Minister of Family Planning during the brutal forced sterilization campaigns undertaken by Indian Prime Minister Indira Gandhi under the guise of family planning. The barbaric policy backed by the UN Population Fund and the World Bank involuntarily sterilized millions of poor and lower caste Indians, about 15 times more people than the National Socialist Nazi regime in Germany sterilized. Even the namesake Another member of UNESCO Government Board is Dr. Richard Davidson, who is affiliated with everything from the fascist Great Reset promoting World Economic Forum to New Age occultism. Perhaps even more important is that he co-authored a book with Daniel Coleman, the premier outfit promoting highly sophisticated psychological manipulation and conditioning of children using Cell. Admitted on its website that the whole idea of Cell came from the Fetzer Institute, an occult New Age organization founded by a disciple of Lucifer Publishing, Alice Bailey. It goes into explaining the malleability of minds, even at our age. We can all be suckered into this, but especially the very young individuals. And it actually goes into mindful schools. It mentions a lot about mindful schools in this. It's a part of the system. Indeed, even officially, a key focus of the India-based UN Education Institute is achieving Agenda 2030 Sustainable Development Goal 4.7, a subsection of one of the global organization's 17 SDGs. Taken together, the goals do the Master Plan for Humanity by the head of UN General Assembly in 2015, when it was being adopted, are a roadmap toward global technocratic government, complete with international wealth redistribution and tyranny. All learners acquire knowledge and skills needed to promote sustainable development, included among other through sustainable lifestyle human. Master goals, UN is weaponizing education to promote its Agenda 2030. In other words, every child on the planet must be so indoctrinated he or she will submit to the UN's perverse master plan for humanity. Breaking down those elements further, it is clear that this indoctrination is incompatible with Christianity, Western civilization, patriotism, the nuclear family, and a general understanding of God-given rights, as enshrined by America's founding fathers in the Declaration of Independence and the U.S. Constitution. Notice it also applies to all learners, potentially even roping in adults, religious leaders around the world funded by the UN and rallied around the UN scheme. I'm going to the last, this is the end of the article. As these UN-backed ideas get produced and developed in institutions such as UNESCO, MGIEP, they are then injected into classrooms worldwide through a complex network of organizations. This includes government agencies, teachers, unions, mostly tax-funded, non-governmental organizations, NGOs, universities, foundations, and more. It happens with help from tax-funded grants and free education materials offered to schools and governments, and is incorporated into the curricula, textbooks, teachers training programs, and other means. This is how the global vision gets down to the local school your children and grandchildren may attend. The emerging use of neuroscience and SEL to promote New Age pagan spirituality, woke values, and global citizenship to children around the world is beyond dangerous. The UN is even working to bring artificial intelligence into the process to indoctrinating and fundamentally transforming the minds of future generations. Families who value their children, their faith, their nations, and their liberties, and their God must sever all ties with the system before it is too late. Thank you, Mr. Chairman.
Thank you, Mr. Mason. Mr. Turnbull.
I just wanted to say that it's really a privilege to be on the board, and I thank everybody that's reached out to me and spoken to me about what they would recommend. And I mean, I live up to what I do here, but and you're talking about the motto of the health department, but I remain resolute to the first swearing I've ever done, and that was to swear to support and defend the Constitution of the United States of America against all enemies, foreign and domestic. I swore to bear true faith and allegiance to the same. And after raising my right hand and joining the United States military, which I still hold near and dear to my heart, I swore that I was eager to deploy engage and destroy all enemies of the United States in close combat. I say this all to say that I was a professional soldier for 15 years of my life, wounded during service, in defense of freedom, promoting justice and the American way of life. And I thank everybody for allowing me to continue to serve, now that I'm not in the military, but able to continue to serve here, on our soil and make America better. So thank you.
Thank you, Mr. Turnbull, and thank you for your service. I'm going to be brief also. It has been a long day. Thanks for sticking around. I appreciate the respectful and civil exchange of ideas that took place here. Too often in our world, we're not seeing that anymore. I appreciate that our citizenry is involved, and I look forward to next month's meeting. I will take a motion to adjourn. Thank you, Jairus. I'll second it. All in favor, say aye. Aye. Thanks, folks. Nobody voted.
That would-